Okay, I believe we have started the recording.
Awesome. Thank you, Lily. I love the radical candor that is going on here, which is great and a super important part of improvement science. So appreciate everyone's honest answers in here. So it looks like a lot of folks are heading over to this quadrant in the top right that tells us that you've had some experience, but maybe you couldn't really tell us exactly what it means. Maybe need a little refresher, need some context, which is very common. I'll say that first. So this is nothing to be ashamed of. Yes, Chris Jensen was with the first cohort of the Nashnik. So definitely he knows enough to be dangerous. Chris might have been dangerous before I even met him. So there's that too going on. Perfect. All right. So you guys can continue to add your sticky notes. We'll come back to this board so you can either leave it up or you can close it. No worries. I will give you the link a second or third time. So again, happy to be here. Happy to be with you to talk all about improvement science. We have a lot of ground to cover today. So don't worry if we blow through some of the original time allotments in the first half. I've got plenty of time for us in the second half. I will say I'm originally from the Midwest, so I do talk really fast. So please interrupt me if you have questions, concerns, something I said made absolutely no sense to you. You can, the best way is probably to raise your hand in the Zoom features just so I can see it. But also don't feel like you can't just unmute yourself and barge in. I fully welcome that. This is a small group. We're here to learn from each other. That's what this is all about. So we're all on Zoom. So this is what I look like when I'm not on Zoom. Again, I'm the senior improvement science coach at Nash, but I have a couple other hats that I wear, and I'll tell you a little bit more about that. So we've done the check-in. I want to talk to you just really quickly and put some context around some of the work that you've heard that some of your colleagues have done, and what is NASH, the National Association of Higher Education Systems, doing in this space at all, because I think this is really important. You all are in the field of higher ed, so this is probably something that you know, although some people don't know this, which is the systems of public higher education in the United States. There are 54 of them, and they collectively enroll 7.5 million students every single year. These are public systems of higher education, and these systems educate 75% of the American college-going public. What I like to talk about in this slide is just that, like what Harvard does doesn't actually really matter, right? There's a very small percentage of the American college-going public that goes to very small selective institutions. What sort of matters for us kind of collectively as a country is what happens at our large public serving higher education systems. And so Nash has always been this collection of these systems. They're very specifically set up for the system head. Now, sometimes that person is called a chancellor, sometimes that person is called a president. It varies state to state, to come together and learn from each other, learn about best practices, and really working in this vein of something that we coined this term many years ago around the concept of systemness. And essentially, systemness is really just the concept that multiple components, while working together, will create more positive activity, in our case, and what we'll talk about today, more positive change than any individual campus or system can on its own, right? This is sort of intuitive. There's lots of philosophy around the concept of collective action. That's what this really is, right? Is to say we would be better off if these systems worked together and understood and talk to each other and work together around some big ideas. So Nash has put 3 big ideas up on the board. Nash's goals can be broken out into these 3 big buckets. The first is increasing degree completion. Don't have to explain any of these to you. You all know exactly what I'm talking about. This applies to both the 2-year degree completion and also 4-year degree completion. The second one is improving social mobility. That is obviously something that has come up, I would say, in the last 5 to 10 years as a key element, making sure that folks who enroll specifically from families or disadvantaged backgrounds are actually getting the social mobility boost that higher education can deliver. Doesn't always, but we need to really be focused on that as one of our prime directives. And then the last one is reducing student debt. I think as public higher education systems, you all and others are very well poised to do this. Obviously, the cost of attendance is not what we see at private institutions, but there's still more work that we can do to make sure that students leave with a degree and with as little student debt as possible to set them up for success later on. So this is what NASH is out there trying to do. And how are we going to do it? NASH has sort of 3 main strands of work around this. And I won't go into this too much, but there's an Institute for Systems Innovation and Improvement. That's what we'll talk about today. There's also a Center for State Policy. This is really to address the fact that states need to invest in their own public systems of higher education. What does that look like? All of that. And then a Partnership for Federal Support of Systems. This specifically talks about the investment that's needed at the system level, the system office level, sort of, again, whatever that structure looks like in your state. So these are sort of the 3 main strands. Where I sit, is the Institute for Systems Innovation and Improvement. That's where all of this work that we're going to talk about today lives at NASH. So I just kind of wanted to let you know a little bit about that. And we have, at the Institute, we have our own theory of change. And I wanted to kind of just quickly walk you through this because I think it's important for you to understand what we're up to. And I know, again, some of you have engaged in this work in a much deeper way, and some of you are newer to it and might be interested in thinking about how we can bring some of this to your own campus or system. Our theory of change is pretty linear, right? We start with the goals of introducing and inspiring, so introducing improvement science to the field of higher education and its key practitioners, aka you all, and really inspiring a new way of doing business. And I hope at the end of this presentation together, you'll sort of see what I mean by a new way of doing business. We also, we think that there's a huge need to educate professionals on the basics of improvement science and its applicability in higher education. Luckily for you all, you have Lily and her team who have already invested in this, so you're going to get a taste of it today. But we are also offering in this year and years to come, lots of educational opportunities for folks to take advantage of. Engaging folks directly in the work of improvement is super important. Your colleagues here on the call who have been working in a NASHNet can tell you more about it, and really demonstrating impact. To me, this is the most important part of our theory of change. Improvement science will really only catch fire in higher education if we maintain results, and I'll share some of those results with you today. But that really is going to happen by being directly involved with campuses and systems like yours. We maintain an eye towards innovation. So the work that you're going to hear about today has to do with the Transfer Student Success Improvement Community. As of this year, we are launching improvement communities in other domains as well, because we really want to make sure we're constantly improving our own model of continuous improvement. It's a very meta statement, but we want to bring in new concepts, new people to this work. And then lastly, our goal is really to empower. It's partially why I asked you where you think you fall. We'll come back to that slide later and see if you want to move your Post-it note. We really believe that we're going to need a huge number of credentialed improvement scientists in the higher education community in order to hit some of these big goals that we have. So that's our approach to how we're going to get this done. I want to dive right in and talk about improvement science as applied to higher education, because this is really what you're here to learn about. Is what is this? How does this fit into higher education? What can I do with it? I think is a big question, obviously. And I always like to start with this quote, knowledge is only a rumor until it lives in the muscle, because to me, this is so much of what improvement science is really all about. The work of improvement really stems from the difference between the knowledge that something can work and the knowledge of how to actually make it work reliably over diverse contexts and populations, right? Just read it one more time because it's kind of a mouthful, but this is really where I want you guys to think about all of what you're going to hear about today. The difference between the knowledge that something can work and the knowledge of how to actually make it work reliably across diverse contexts and populations. Now, sometimes people read that and they say, okay, yeah, I get it. Sometimes in higher ed, we call it, the research practice divide, right? Whatever you want to call that. I think we often minimize it to a very extreme degree. And we sort of talk about this, yeah, there's some other stuff we could be doing, but ultimately, everyone's kind of in the same boat and we're doing the best we can. If I had to sort of illustrate the size of this divide, this is the photo that I would use. Because the real point here is that we're actually really far away from being close to closing this gap. I'll talk a little bit more about how improvement science comes from the discipline of healthcare. But I think sometimes looking at other sectors gives us a sense of what we're talking about in this sector. In 2001, there was a very seminal piece of research that came out, and it was called Crossing the Quality Chasm, which was a goofball name. But basically, what they did is a bunch of researchers looked at a whole lot of research about clinical practice. Basically, what should be happening inside of hospitals, clinics, your primary care doctor office? What should be happening day in, day out from a list of basically our most common illnesses, right? And what they saw was that there was a 17-year delay between when scientists learned something from rigorous research. Basically, someone said, hey, this is how we should actually treat diabetes because it leads to better outcomes. 17 years between those scientific discoveries and what actually happened in the day-to-day lives of healthcare practitioners. So what happens at hospitals and clinics, right? That's a 17-year delay. I often say, like, raise your hand if you have a child, right? Like, how that 17, 18, that is a long time, right? And for anybody who has any sort of medical diagnosis, this is not a good piece of news for you, right? You don't want to think that you're getting treatment that someone 17 years ago came up with, right? Because I think the natural next question is like, well, what have they been up to since, right? Are there better treatments? Is there a better route of cure that I should be following, right? I'd love to give you guys some examples to make some of this tangible, right? So in the 80s, it came out that we should really screen all women under the age of 30 for cervical cancer screenings. The women in the room know exactly how pleasant this is. It came out that, yes, this should be done every single year and everyone under the age of 30. Turns out that that was completely false. And yet for many, many years, we were forcing people to go through this procedure just to get actually what ended up to be a whole lot of false positives, which sent people back for more testing. You can see where I'm going here. This is all incredibly inefficient, right? It's estimated that 75% of musculoskeletal, that means backs, hips, knees, your joints, 75% of musculoskeletal surgeries are actually avoidable with non-operative care, which basically means like we don't need to be replacing people's knees, arms, joints as much as we do. What we see is that we're spending as a nation about $213 billion in this around treatment, care, and then loss of wages annually, right? So we're spending a whole lot of money, time, and I would say most importantly, people are on the operating table when they just don't simply need to be, right? So you get my point. You can see the other examples here. There's a whole lot that we know about health and healthcare that we're not actually doing day in, day out at the point of service. And this is where I want you to start, in your brain, in the back of your head, starting to think, okay, so if there's a 17-year delay between what we know we should be doing and what we actually do, how long is that delay in higher education, right? Because on top of just the inefficiency of it all, there's another name for this, which is unnecessary human suffering, right? We're making people go through things they just don't need to go through. I completed most of my work in education reform in New York State. So you'll have to excuse my bend towards New York, but I think if I did this graph for any state in the country, I think you'd end up with something pretty similar to this. We used to call it New York's leaking education pipeline, right? So for every 100 ninth grade students that begins their high school journey, 69 students will eventually graduate 4 years later. 41 of those students will enter college. 33 of those 41 will actually come back for their second year. And at the end of that, 19 will graduate with an associate's degree or a bachelor's degree, right? So we're kind of talking about some of the same failures. It's in a different context. And I would also just posit to you, this is also just another way that we are actually creating a whole lot of unnecessary human suffering that doesn't actually need to happen. My trajectory in all of this, which is, I think, the only way I think it's useful to introduce myself to you all. I started my career in public higher education at SUNY, the State University of New York. It's a 64 campus system. It's an integrated system. So we have both 2-year and 4-year institutions, flagship research. It's all in one system. I fell in love with the concept of public higher education, but I think I always tell people higher ed wasn't my first love, but my eyes were open to how big the system really was, how much change was needed, and how unable we were to really get our arms around creating change, not just at the campus level, but also at the system level, which really led me to think about how could you create change on essentially a large scale over time. I went on and worked for the governor. I ran his education reform, which is the K-12 work. I always say about that time, it was a really great piece of work. We spent 12 months going all across New York State, hearing from lots of different stakeholders. And at the end of the day, as many of you have probably gone through something like this, we put together a 10-point plan. And I think we printed about 200 copies of that 10-point plan. And I'm fairly certain that no one ever read the 10-point plan. And I'm very certain that the 10-point plan was never implemented, right? And this is sort of a very common way that public policy is set in this country, at least right now. We sort of try and come up with the things that we're going to do. And then we end up realizing those things actually don't get implemented and don't create change. I left that and ran a public-private partnership that was called the Albany Promise. This was a place-based initiative, a cross-sector place-based initiative to try and figure out how could we do things. Perhaps I went too far to the other side on a very micro scale and create change in just one singular city, focusing on our most disadvantaged kids and families. This is where we really started to implement a lot of the stuff that I'm going to talk to you today about improvement science. We basically we upskilled an entire K-12 district in how to run improvement cycles. We saw population level change over the 6 years that I ran that. So we saw a 13% bump in high school graduation, a 25% bump in post-secondary enrollment, a 54% bump in kindergarten readiness, and a 14% bump in third grade reading rate. So you can kind of see we were all over the place with this. We were a model for the country, and this is my favorite embarrassing story about myself. We actually, the work that our collaborative did won us the Champion of Change Award at the White House. This is the only photo I have of that day, and my eyes are closed. So I think this is a good reminder to just stay very humble about any sort of award that you are given. I then actually transitioned and worked in the Department of Health in New York State. We ran essentially what I would call a scale up of the work that we had done at this cross-sector partnership. We ran an initiative where 90,000 healthcare providers worked on continuous improvement for a 5-year period. And over those 5 years, we reduced the avoidable hospital rate by 26% in New York State. Those are for individuals who are on Medicaid. That's a low income health insurance program for the state. And that basically equates to about 300,000 individuals avoided hospitalization that didn't need to be hospitalized. We then turned around and initially reinvested those savings into something that we called the first 1,000 days on Medicaid. So we took our learnings and said, 1 of every 2 children in New York State is born on the Medicaid program. How can we make their first 3 years of life better? And again, we used this concept of continuous improvement, and we improved I won't talk about all the things we did, but I think one of the things I often talk about is just the well child screening rate. So this is making sure that young children, if you have young children at home, you know the well visit routine very, very well. For our Medicaid population, our well visit rate hovered at about 13%. So only about 13% of our kiddos were getting their well child visit rates. Today, it hovers at around 83%. because once again, we use the principles of continuous improvement. And now I find myself here. So as you can tell, I've sort of done like a 180. I've come all the way back to my roots. And that's what I'm doing here with Nash and the improvement work that we're leading here. I tell the story in this way, partially because I want you to see that improvement science is not something that belongs to one sector. We'll talk a little bit about its roots and how it began, but this is really something that multiple sectors use today to manage and improve how they operate. I would say the exception to that rule is probably higher education, which is partially what we're doing here. So let's dive in. The first place I love to start is just kind of talking about improvement is hard, because I think this is one of the things we don't acknowledge probably enough. There's a famous McKinsey study that you've probably heard about that estimates the number of change initiatives in corporate America that fail at about 70%. So 70% of the time that we go out there and say, hey, we want to improve something, we want to create change, that change initiative will fail. And there's some really good reasons why this is. And I sort of say there's good news and bad news. The good news is that improvement science is an actual discipline. There are people who study it, write about it, practice it, refine it, spread it. I'm part of that community, but there are lots and lots of smart people who are much smarter than me and who've been doing this for much longer. So that's the good news, right? We don't have to kind of crawl around in the dark. We actually know what are the science-based approaches to create positive change. The bad news is that as a society, we're still not embedding it into training programs for almost any discipline. I'm sure that some of you have gone through probably some higher education administration courses, maybe some public policy courses, whatever that was for you. I'm willing to bet my life savings that there weren't a whole lot of hours in those programs dedicated to teaching you about the science of improvement and improvement methodologies, right? Science of improvement is not embedded in many trainings. I will even throw my own current sector under the bus. We don't even train clinicians how to do this. They typically find this training after they've entered the healthcare field. So the structure is basically inherently flawed, right? You're either an improvement expert or you're someone who practices in the discipline. You're not both, right? As a friend, Becky Margiata, who ran the 100,000 Homes campaign, that was a campaign to house 100,000 homeless veterans, once said, I think we have to train 1 billion problem solvers. And that's part of the work that we're going to do today and what we're trying to do at Nash. So let's talk about higher education for a second, get really specific to your context. Like many sectors of our economy, yours, higher education, is facing pretty significant pressures to stay relevant and financially viable. I don't have to tell you this. You all probably read the Chronicle much more often than I do. The number of mergers, acquisitions, closings is accelerating, right? You are in an industry that is not at its high point, right? Predominantly, we'll say the industry is measured by a few key performance indicators. These are just ones that I chose. You can probably build this list. Enrollment trends, which as of yesterday, I suppose, we can all cheer that the National Student Clearinghouse got it wrong and we're actually on the upswing for this time. But you're looking at enrollment trends, you're looking at retention trends, you're looking at student completion, and now you're looking at student earnings to understand student mobility, right? And as a whole, and this is not to throw any specific campus or system under the bus, as a whole, when you're measured against these key performance indicators, systems and campuses face pretty mixed results. This was actually an AP story about CSU that came out while our CSU teams were actually at the in-person meeting last year. You can imagine this didn't feel great for them to hear. It was basically a 10-page expose about how students in the California system felt like community college transfers really were a waste of time and that they had to start all over again. But like most industries, here's the good news. Again, there's a wide gap between current practice, what is actually happening on campuses and in systems today, and best available knowledge, which means the evidence of what is possible. And this gap is the variation in results that we're really focused on in improvement science, right? So to make it really tangible for you, I want you to look at this graph. This graph is specifically about the transfer out bachelor completion rates. And this is obviously every dot is a campus. So what this research is showing us, so on the bottom there, you have number of transfer students. So you can see the further you get to the right-hand side, the larger the institution. And then on the other axis, that's your completion rate, right? So there's a couple things that you can tell, right? So you can tell that obviously there are more circles on the left-hand side. So most colleges have fewer transfer students, but you have a couple over there on the right-hand side that have over 1,500. But what I want you to look at is look at the level of variation. Basically, how many campuses are up there at that 70% completion rate and how many are down at that 10% completion rate, right? That's variation. And if anybody is a statistical whiz, feel free to chime in and have a short chat about statistical variation. But the thing that I want you to think about just for a second is how would our society feel if hospitals or air traffic control had this level of variation, right? If in some hospitals you had a 70% success rate of amputating the correct leg, and in other hospitals you had a 10% success rate of amputating the right leg, right? This is why variation is so important to understand. And then the next step, which is using continuous improvement to squeeze out that variation, right? The example I always give to people is, when you get on a plane to Denver, you sit down in your seat, you pop in your AirPods, you're not worried that that plane is not going to land in Denver and that it's going to land in Santa Monica, right? Like you're pretty damn sure that it is going to land in Denver, right? That's not a mistake. That's not by chance. That's because the airline industry has been built with lots and lots of process improvement to make sure that you arrive at your destination, right? So that's variation. If we want to solve for variation, this is where improvement science comes through as a tool to figure out how to solve for variation. Again, just reminding you, this work is about bridging that divide, that something can work, and how do you actually make it work every single day. The best conceptualization that I can give you about how this is a different approach of change, and I know that in your other symposium courses, you've been hearing about different ways to create change. Improvement science is just another tool in your toolkit. It's just another way to say, okay, we have a change that we're trying to make. How do we get ourselves there, right? But I think one of the most important things is to build a mental model of what is our current approach to change. And this is my visual representation, which you could probably tell I've not gone to art school. This is my visual representation of how decision-making and approaches to change currently operate. Maybe you can see yourself in some of these illustrations, right? So we'll start at the bottom left and say, okay, so a bunch of people come together because there's the identification of a problem on a campus, right? So we'll just say, we'll just say for this sake of this conversation, right? The president has decided there's a problem on campus, and all of a sudden there's a cabinet meeting. So there's like 3 or 4 people, maybe just the vice presidents or whatnot. And they come together and they say, okay, well, we have to solve this problem, right? And they sit in a room and they come up with a 10-point plan. And that is typically what we refer to as strategic planning. And what that does is it creates a list of interventions or ideas that then is going to be implemented campus-wide, usually. Sometimes we even make the mistake and go system-wide. And what we say is, okay, these are the ideas. The 4 of us sat in a room. We think these are good ideas. Maybe we read an article about what Georgia State is doing. And we love that idea so much that we're going to go ahead and just do that. Well, that ends up going into implementation right away. And that's that green line, right? And I want you to look at what's happening around it, right? So user feedback that you're not hearing because you maybe didn't involve the user. And I know you guys have done some journey mapping and some design thinking. So hopefully you sort of heard some of these key points before. There's unintended consequences that you're not experiencing. So maybe you are fixed one thing, but maybe the other, it's breaking something else, right? There's failures that you don't understand because you're not collecting the right amount of information to understand what's happening. There's also just context that you're not aware of, right? And so this is where you get that implementation of change doesn't actually end up happening. And that's where you get to that failure. More importantly, and I just want you to take a quick kind of look right here. This is my employee corner, right? So these employees are going to start saying, well, that didn't work, right? Let's just go back to the old way of doing things. At least we all understood what we were supposed to be doing before, right? And the most horrific thing you can ever hear is, I've outlived this bad idea and I will outlive the next one. And what you're essentially doing to your workforce is you're burning them out from change because it's not well managed. And what you're creating is an entire workforce that doesn't want to participate in change initiatives as they move forward, right? So how does improvement science take a different approach to this? Well, we start back in that lower left-hand corner. The ideas for change are not created from a small group sitting in a board office somewhere, right? We create teams, which we'll talk about today, and we generate bottom-up solutions created by those people who are closest to the problem. And when I mean closest to the problem, I just mean whatever problem you've identified that you're trying to solve. We'll talk about the transfer problem in a second, right? So that would be, who would that be? That would be your advising team, right? Who interfaces with transfer students day in, day out. People from your admissions office, folks maybe who sit in the student success office, right? Whoever those people are, they're the ones who are going to come together and say, hey, I sit here and I talk to transfer students all day. I can tell you that this is where the problem really begins, right? And then what you see is, instead of putting together a strategic plan that then gets rolled out, we do what's called small tests of change. And what we do is we take an idea and we test it on a very small number of students. And when I say very small, and everybody who has been with me before knows this is the rule. If you can't take everyone out to dinner who you tested this on, you're testing too big. Why do I say that? Because if your test fails and makes the situation worse, you can take 5 students to dinner. You can get them a gift certificate to Starbucks and say, my bad, we were trying something new. It really went, screwy on us. Apologies, have a Frappuccino on me. If you go immediately campus-wide, there is no amount of money that your dean is going to approve to apologize to 2,000 students all at once. And what have you now created? Your workforce doesn't believe in the way that you're solving problems because everyone hates getting yelled at, right? Your students don't trust you because you just made their lives harder. See the difference there? It's actually a way to de-risk change. Because if you do something to 5 students and it goes crazy bad, you can fix it, right? So we do very small tests of change, and we'll get into these in a second. If it goes well, let's go on the positive. Okay, great, we learned something. 5 students did something that we wanted them to do suddenly, magically. Okay, then we're gonna do a follow-up test. Next time we test it, we're gonna try it on 25 students. Next time we test it, maybe we started with the business school. Next time we test it, we're going to invite the School of Engineering. If you're really in for a ride, we're going to talk to the teacher prep folks, right? You're going to do this in slow, iterative patterns so that you're not breaking things so fast. You're actually learning as you go. And that's where you get to this concept of implementation of a change idea at scale without failure. I say this constantly. If you're using the improvement science methodology, none of your implementation will fail because you're actually not jumping to implementation. You're getting there in slow steps. And so you're making sure that once you go, let's call it campus-wide, you know that this thing is going to work and it's going to produce quality with reliability at scale. And that's what you're looking for. Back down here to my workforce, my green guys down here, what you're going to start to hear from folks is, hey, let's do that again. Let's try that. Let's try it on a different problem. We have lots of different folks, and Kentucky is no different. The folks who went through our very first cohort of this, every single system that participated has launched their own NIC because it got people on their campuses and in their system offices so jazzed. Now, they're not all about transfer. Some people are dealing with stop outs. Some people are dealing, they're all over the place, but they got people excited about doing, this is crazy, right, guys? More work, creating more change, and getting the institution to perform at a higher level, right? And lastly, I would say you sort of get to hear these things about, I'd like to lead the next round, right? I would like to be a leader in improvement science. Today, improvement science is the dominant methodology of quality in manufacturing and assembly. So this is where I always say depending on who you're married to, go home tonight and start talking about quality, because you might have some really interesting conversations. Manufacturing and assembly, software building and maintenance, this is how they do things. Military management is often very much run in a improvement science-based way. And of course, clinical healthcare settings, which I guess I should have said, that's where I do the predominant amount of my work. So if you hear me bringing in healthcare examples, know that that's why. I also like to give people examples from sectors that are not their own so that you can kind of understand it. There has been some work to build improvement science into K-12 education. I sort of mentioned some of the work that I had led, but there's been no significant attempt at implementing it in higher education really until now. And this is really the work. This is really the work that higher ed, that NASH is trying to do. I want to take a second and just address something that was in the chat, which is a great point here. And Kashana, I think is how I pronounce it. Correct me if I'm wrong. She's pointing out that in other fields, success rates are dependent only on employees or institutions, and your success rates are based on both the employees, institutions, and the students themselves, which will always be an uncontrollable variant. I love this point. We have something in healthcare that we call, it's often found in the notes of an EMR. And what we tend to see from doctors, nurses, clinical staff is a simple note that says, patient was uncompliant. Patient did not comply, right? And I will, yes, thank you, Stephanie. One of the greatest stories I can ever tell you about how much we blame patients in the healthcare industry is a story of quality that happened at a hospital that I was working with, where they had actually had a number of patient deaths. And these deaths were very much related to pharmacy. They're what we call pharmacy deaths. So basically where we trace back where the problem had actually occurred because someone had either been prescribed the wrong medication, taken the wrong medication, something about medication had gone wrong. And when they did a deep dive on why this person passed away, they saw in the medical record that the person had multiple times indicated that their primary language was Spanish, that they did not speak or read English. And when the person looked at the prescribing, the actual bottle of medications that had been printed and prescribed for the person, they had seen that it had only been prescribed in English. And so the directions were in English. And the directions were to take once a day. If there are any Spanish speakers on this call, you will know that once is written the same way that once is spelled. And so we sent a patient home with a bottle of pills that they read to say, take 11 pills a day. And I would just posit to you all, was that the patient's fault or was that the system's fault, right? Because we can do a whole lot of patient blaming, and I think higher ed has its own version in student blaming, right? That person had told us that they did not speak English. Prescribing, just to kind of tell you, it's very easy to translate the requirements on a pill bottle to a different language. It was because the system was set up in a way that did not let the patient get that outcome that we needed. So yes, patients, students, faculty, right? We can say it on this call. Those are all going to be uncontrollable variants, right? But what we can do, like healthcare, like the airline industry, is reduce the number of causes of variation. We can make the system so easy to navigate that students don't go down the wrong path, that they don't do what we would sort of say the wrong thing, right? There's this concept of improvement science that we often call the 80-20 rule, right? You want your processes to work for 80% of your population. That way, for 20% of your student population, it's never going to work, right? I'm talking about the person who has transferred in from 16 different universities and did 3 credits at each. Yeah, that's not going to work through a standard process. Someone's going to have to sit with that person and do a real deep dive. But one of the best things I can tell you, and closing my eyes and not knowing your institutions, you're not at 80-20, you're at 20-80. Your processes only actually work for 20% of your students. And so your staff's time is dedicated to problem solving a whole lot more than it needs to be. And when we reduce variation, when we get to efficiency, we actually change that and we help your workforce do less because now they're just focused on that last 20%. They're not focused on the bulk of those students. So great point. Happy to chat more about it, Kashana. But it was a great point. And I did, thank goodness, build in a little break here. For this little introduction, I'm curious, what are your comments? What are your questions? Did your brain make, a whole bunch of new connections that maybe you hadn't thought of before? Let's just take a quick minute. I'll stop sharing so we can actually see each other and take a few comments, questions. Not everyone all at once. Come on.
I'll ask a question. I love this idea, especially, trying and having examples and things like that. But what if you need to make change quickly? Because the idea of, starting small, then bringing in, and again, I'm from a small university, so we probably have more options on that. But if you're looking at like a large institution, how would you implement this on a quicker timeline?
Yeah, so I guess my question to you would be, why do you feel like you need to make change quickly?
And again, this is just gestalt thinking, like broader.
Yeah.
I think more in terms of the changing landscape that we see in higher ed right now, that historically, the more longer, slower change that we've seen before may not be as suited for some of the changes that we are going to be encountering either this year or next year or within the next few years.
Yep. Great point. So I think, the greatest example that we all lived through was the pandemic, right? So I'll pick an example from my sector. Telehealth has been around, I think, since the fax machine was around, or at least since phones have been around, right? Like, we should have been taking appointments over the phone, if not video. Let's leave that aside, just phone, right? And everyone said no. Everyone said, no, we can't because of this, but we can't because of that. And let me tell you, when COVID-19 hit, it took most practices 7 to 10 days to move to telehealth appointments, right? What did it tell us? What did it show us? It showed us that under great uncertainty, when the pressure is so enormous, when there is no other option, you can see really rapid change in a very short period of time. Now, let's caveat that, right? Everyone has a video phone today. That was not true 10 years ago, right? So there are contexts in which you can see this like very rapid change. That specific, environment and moment happens rarely. And I say that because, Patty, and the reason I asked the question back to you is, I think oftentimes we think we need to make radical change, and there's sort of this like artificial pressure, but it's not real change. And I would challenge anyone on that is, and maybe this is because I worked in the governor's office for so long, but I kind of talk about like change via press release, right? Like you see these press releases go out. This is one I remember from when I was back in higher ed, so this will date me, but Starbucks and ASU partnering together to offer every Starbucks employee free college. You guys remember that? Well, I don't know off the top of my head how many employees are at Starbucks, but let's just call it 200,000. I don't know. There's a lot of Starbucks in the country. I recently went back. Do you know how many students actually completed a degree? It was 200 and something. So whatever that math is, it really wasn't seismic change, right? But in today's environment, it's really sexy and exciting to write that press release, right? Hundreds of thousands of students, right? Like, you have to kind of take, you have to be comfortable, which is uncomfortable, Patty, I'll admit that, of taking a step back and saying, do I want change immediately? Because I'll tell you one thing, most immediate change is fake. It's not sustainable, and it will fall apart. Or am I going to prioritize? No, there needs to be sort of fundamental realignment and redesign here. And we're going to all acknowledge as a team that that's going to take more than just putting out a press release or hiring, a fancy consulting firm to tell us what to do. So great question. I love it. And I love sort of putting pressure back on y'all to say, because I get it. You probably get it all the time from, presidents, vice president, whatever. It's like, well, we got it. do you, and we'll get to this in the next section, like, do you actually understand what the problem is? I work with teams all the time, and they will tell me, yes, Juliet, this is the problem. And then I say, okay, let's go get some data. Okay, let's go get, and it turns out that that's not the problem at all. And what I'm cautioning you all is get out of the habit of what we call solutionitis, right? Where everything's a solution, where jumping to telehealth is going to solve everything. And jumping to dual enrollment, sorry, whatever that thing is called, dual enrollment's going to solve everything, right? Getting everybody in high school enrolled, that's going to just slow down a little bit and think through and we'll get to this, like, what am I trying to solve? How do I really understand the problem? And lastly, I will say, Patty, the small tests of change concept, and you'll see this, we make it small because we shrink the timeline. So an action period is 45 days. So we've had teams where they start with 5 and 45 days, and the next time, they're at 50, and then the next time, and I will show you a case study, actually, it's coming up, that you can actually see how a university in a pretty short order got to full implementation at scale across the university. It's a great, great, great question. Thank you, Patty. Anybody else? Yes, Chris is mentioning COVID. Yes, of course. Visit experience to be virtual. Hindsight, we could have had all these cool options. Not negative. Yeah, sure. Yep, absolutely. Yeah, Amy went to a video visit during COVID. Suspected appendicitis, sent me to get an MRI. Yeah, yep. Trying to think of how we used. Yeah, very interesting, Amy, your point. What I often talk about and this is slightly off topic of improvement science. The hardest thing for any intervention, it's not the intervention itself. Like we mostly know, and I'll just pick on advising. We mostly know that advising at the right time with the right person can make a world of good. It's not that we have to reinvent advising. It's that actually you're advising the wrong students, you're advising them at the wrong time, right? It's really getting this cadence of when do you do it, how do you do it, and how do you find efficiency? That's the harder part, right? You guys actually know what good advising looks like. I don't. That's not my square inch of the world. That's yours. You know what good advising looks like. It's more about figuring out from the system, when does it need to happen, and how do you make it happen? Other reflections that people want to share? Any other like random question that set off in your mind that you absolutely must have answered before we move on, which I would welcome? Yep, absolutely, Stephanie. Rapid change presents as much risk as the change being too slow. Yep, absolutely, I agree. All right, forever hold your peace. I'm just kidding. We'll have lots of other breaks. I gotta put in breaks, otherwise I'll get carried away. You guys probably figured that out about me. Okay, so that is very high level. What in the world is improvement? Let's talk a little bit more tangibly about what we're doing at NASH, and then we'll get into more of the specifics about improvement science. So the NASH improvement model builds on what I call the best of improvement science. We're taking two approaches to improvement science. One is called the model for improvement. I got to tell you one thing about people in the improvement space. We are not good namers. We just name the thing what it is. We don't like do the cute titles. This is called the model for improvement. That is its name. And it is the model that you can use to get to improvement. If you are interested, it is detailed in this book that is called The Improvement Guide. We are very clear in the improvement world. We don't mess around. I will send you guys all the link to this. It's a pretty hefty guide. It's not to be read before bedtime. It's more of a reference guide, but if you're really interested in learning more, I highly, highly recommend this. That has been kind of like smushed together with what you see on the right-hand side. The right-hand side is the Institute for Healthcare Improvement. The Institute for Healthcare Improvement, IHI is what it's called. You'll hear me say that a couple times today. The IHI is the gold standard of improvement science in healthcare. They are really the global leader in how do you do improvement in healthcare. So if you hear me talk about IHI, that's where I was trained. If you hear me talk about IHI, just know that's what that is. They have a specific model. It's called the Breakthrough Series Collaborative Model. And it looks a little bit like this. And if you want more information about it, I can give it to you. We're not going to spend too much time in what this looks like, but I just want you to know I'm very clear about what we have invented and what we have not. And the science and the approaches that we use, we have not invented. We are standing on the shoulders of the last 250 years of improvement science work, and we are very proud of that. What we have added is this last little bucket that you see on the left-hand side, which is obviously NASH's higher education expertise. And when I say NASH, that both means at the central office, but also having all of you, having the systems, having the teams participate. That's where we're adding that higher education touch. So that's all I'm going to tell you about the theory. You and I can do one-on-ones and talk more about theory. Trust me, that makes me a happy person. I want to talk a little bit about what this looks like in the NIC model. So you can do improvement one-on-one, and we'll talk about this after lunch. You can do improvement one-on-one. You can go home today, this afternoon, and back to your office and say, hey, I'm going to run an improvement project. Love it. Great. One-on-one, small project. Great. What we know in the field of improvement is that when many teams come together, we learn faster from each other. And so we have this concept of an improvement community. And that's just a fancy way to say a whole bunch of teams working on the same objective learns faster than just one team at a time. So this is what our NIC model looks like. I want to start with the results because I think this is where anybody should start. Over the past 2 years, we have had campuses from all across the country, and I'll show you who they are in a second. What we saw after participating in the NIC was that 84% of the campuses saw year-over-year improvement of transfer student enrollments, which was the goal. That was the aim of this NIC, was improving transfer student enrollments. Just to give you a sense, obviously, the number and the variation in improvement was different. In Texas, Prairie A&M University implemented a suite of improvements based on 19% increase in first-time transfer enrollments. Prairie View is a very large regional institution. In Illinois, Urbana-Champaign, which is the largest, it's a 4-year research institution, saw a 22% increase in their transfer students over 2 years of their participation. And in Pennsylvania, at Kutztown is a small regional, maybe more in line with what you were thinking about, Patty. They developed, one of their projects was to develop individualized student success plans, and that led to a 72% increase in transfer student enrollments in just one academic program, which is where they were testing. So you can see that when we look at the outcome measure, which is student enrollment, we see quite dramatic change. This isn't like 1%, 2%. We're seeing double digits, and in some cases, almost doubling. Just going to run through these really quickly. We've had 3 series participate in the NIC. Illinois, Pennsylvania, Texas, and Kentucky were our first participants. In Series 2, we added Connecticut, Arkansas, the University of Wisconsin, and Cal State. And then in this 3rd series, we have added the City Colleges of Chicago, Mississippi Community College Board. Just to call out, these first 2 are actually community college systems, not 4-year institution systems. And we also have Mississippi Institutions of Higher Learning. That's the system office for the 4 years, and Southern Illinois. So we have quite a mix of campuses. These are the teams at the 2 times a year we get together in person. So to give you a sense of what does this look like when you're in an improvement community, this is the program year. So this runs 1 year at a time. And what you can see is we get together at the very beginning. We do a whole lot of assessment and preparation, which we'll talk about, what you need to have built in before you even get started. Then we have workshop 1 is in person and workshop 4 is in person. We are coming up on our workshop 4 for our latest round. And what I want you to just focus on, don't worry about the dates or anything else, but I want you to see is this cadence. We get the teams together, and then we launch into action periods. And these action periods are 45-day cycles, 45 business days. Chris can giggle because the first year I accidentally did not business days, and suddenly these action periods felt really short. So always make sure you know what you're talking about. 45 days, action periods, right? This is what I meant by your tests of change are small, also because you only have a small amount of time. 45 days is practically nothing, as anybody who's been in the NIC can tell you. By the time you get home and get back caught up on your email, the action period is halfway over. But this is a really core component of improvement work, because to Patty's point, if eventually you're going to get to scale, you can't have one action period in a year. You'll never get to scale, right? So we actually have these 4 action periods across the calendar year. That gives our teams 4 opportunities to test 3 projects each time. We'll get into more of that later, but I wanted you to sort of see this is the cadence and the structure that our teams go through. What does that give us, right? In series 1, when we had 4 states participating, we had 119 tests of change that were built over that first year. You can see that 80 of them were executed. I want to be honest with you guys. People make plans when they come to a in-person workshop, and then they go home, and then they realize that the thing that they thought was going to happen can't happen for whatever reason, right? So there's always a little bit of a lag between how many tests of change you anticipate and how many get tested. Why am I sharing this with you? Sometimes people ask me, Julia, why do I have to do 3 tests of change? You know why? Because of your 3, I'm assuming you can't do 1 because something's going to happen. And now you're left with 2, and that's a great number, right? So you never want to have just 1 test of change going at a certain time, because you're not going to have enough change happening for you to actually understand what's happening. In series 2, we ended the year with 233 tests of change. And as you can probably imagine, in series 3, now that we have 12 states participating, this number has jumped again. So over 2 years, we tested 352 tests of change. I challenge you to name the last time you have seen something where so many different things were tested all at once. Higher ed is one of those industries where, as I think somebody else said, like, we go slow. We do one thing at a time, partially because you're always told, well, you have to do it to the whole campus. You have to do it to a whole. When you go in short bursts, you're actually able to try lots and lots of different things. Why is this important? The more you test, the more you deepen these 2 key things that we're going to talk about in a little bit. The first is the appreciation of the system, which basically means how well do you actually know your own campus and the inside? How does it work? Where are the fault lines? Who is doing what? The real deal, not what's on paper, but actually what's happening day in, day out at your campus. And the second one is your theory of knowledge, which we are going to come back to. I want to do a quick case study because I think this is really important for you guys to see sort of how this works. I'm stealing my slides from my colleague Tracy at Shippensburg University in Pennsylvania. And what I just want to show you is the sequential testing concept. Their problem that they were solving were that they needed to decrease the time for registration for confirmed students. So this was their current process. Look at this, October 1, students sent the advisor contact information once their transcript was evaluated. Then they sent them directions on the registration process. The advisor would respond to outreach. Hey, if the student outreached, right, back to our student blaming, well, if they didn't outreach, we can't help them, right? Okay, so we're waiting around, waiting for them to email us, right? November 2nd, registration opens, the student registers for the courses, and then the advisor meets with students. Look at this, average number of days for registration was 15. So it was taking the students quite a long time to do it. So what this group did was they said, okay, how can we do something differently? Let's figure out a way to get more efficient, right? Now the advisor gets that individual's email when every student is ready for advising. They immediately get a ping from admissions. Hey, Joe Schmo has accepted our offer of admission. Advisor says, great, thanks so much. I email them within 48 hours. And I say, hey, here's how you set up the advising appointment. Choose one, student sets it up, and then the advisor does the advising and registers that student. Here's what the change that they created looked like. In 2022, they tested this in the spring period. It took students 15.3 calendar days to register. These are transfer students, please remember that. And in 2023, it took them 4 calendar days. So they had 11 days earlier, which is a 73% reduction in time. What did this allow them to do? This allowed transfer students to get into the courses that they actually needed to complete their degree on time. This also gave the faculty earlier notice what classes do I need to expand? Do I need a second section of Calc 201, right? All of those things, the students, the faculty started to see. This is Tracy's fancy diagram. We'll skip that for a second. But here's my point of sequential testing. Whoops, look at this. In the first cohort, right, they tested this with 5 programs, and they only had 39 students, right? And then they saw that this worked for 20 of the 39 students. So this was the percent registered by the end of their action period, right? Then they went to 13 programs, then they went to 21 programs, then they went to 28 programs being all of their programs at Shippensburg University. That's not the most exciting part, folks. Yes, it's exciting that they got to scale. What I really want you to look at is look at these red numbers. Look at how the consistency stays put. As they scaled, they got the same result, right? They even saw an increase from here to here. What they're seeing is, this is what I'm talking about, your 80-20. This process works for about 75% of their students. So those 25% who are lagging, yes, they're going to need extra reach out and help, but they've now developed this process that works for the majority of their students. So this is a advanced improvement chart. Don't worry about what it means. These are programs. These are each of the programs at the university. And what you're seeing is how long did it take the students to register, and the size of the box just tells you how great the variation is. So here we go. Tracy's doing her advanced improvement work. And look at this. She happens upon this one department that has the smallest level of variation, right? That's criminal justice. So she walks over to criminal justice and she says, hey, what the hell are you guys doing? And this is what criminal justice says. Oh, we don't do it this way. We go ahead and we register the student for the courses that we know they need to be in. And then we email the student and say, hey, we pre-registered you for the courses that you need next in your degree plan. Do you need advising? Does this not work for you? So they iterated on their existing process, but even within their own institution, they found out that some people were even getting greater results. And as you can probably guess, this team has now turned and pivoted to scale up this intervention by testing it, right? This is that iterative cycle. You're never done. You're always going to be working on the next thing. You're always going to be finding someone who has found a new innovation, and this team is still going. Questions, comments, connections that your brain just made when I gave you that little case study that you want to chit chat about real quick?
So can I ask a question? And
Please.
I'm going to play the doubting Thomas here. That's a really interesting example, but the idea of pre-registering students for classes that we think they ought to take raises the question of other goals of things like enhancing student self-efficacy, right? How do the students learn that, which should be part of their journey here, if we're doing everything for them and they're just following what we do? We also then don't, I mean, I understand that it's the 80-20 rule. So my other objections about choice, exploration, all that other stuff, I'll give up on. But that one really bothers me in the sense that if we do these things for students, how do we build? It answers one goal at the same time that it takes away from another goal, right? So how do we deal with those competing goals when we do something like that?
Yeah, Beth, it's a great question. And as you will not be surprised to know that this question has come up a lot. I think especially as folks get into the like pre-registering, students for courses that are next in their degree plan. And let me also just like quickly say, I'm not an expert in how we build self-efficacy of college students. So let me like say that real quick. It's not my corner into the world. And I'm not gonna go there, right? But here's what I would say. When I have seen these conversations go on from groups, a couple things come up, right? The first is a lot of universities do this for their incoming first-time freshmen and don't do it for other students. And so what I have seen in some teams is this conversation of why do we do certain things for some groups of students and not for others? The second, and especially around this specific example, I don't want to speak generally to, choice, because I think, and some of those other concepts, but is if we have an understanding that transfer students have already completed some of a degree plan, and we're very clear about what next courses in that degree plan actually get them out the door, meaning graduating, on time. You know, the question has been posed to some, like, what are we waiting for, right? And I think where most of the teams I have seen come down on this is it is a process that we're asking students to go through. And the faster we can get these students enrolled and make sure they get to the campus and make sure they show up, like, it's a little bit of a trade-off, which I think is where you were going, Beth, right? Is like, they would rather have the students enrolled, ready for class, get on the campus, and then sort of engage in those secondary activities, secondary goals, as you would put it, about making sure that students build those efficacy skills. Does that kind of make sense? I know that's like a very non-answer answer, and I want to acknowledge that, because there have been so many conversations about this. The other example that I would give you, again, from like another space, right? Amazon and Netflix does not wait for you when you were at the end of a series, right? I don't know, maybe the holidays are over. Anybody watch some really bad television? What happens when you get to the end of a Netflix series? What does Netflix do? Does Netflix shut off?
It starts a whole new series.
It says, hey, wait a minute, don't go. We like you here, right? It starts a whole new series, right? Same thing for Amazon. You buy 3 books, buy your favorite, you know, smutty romance novel, art, whatever you guys are buying on Amazon, they will suggest something else for you. They are inherently trying to make you do something. We can have very different discussions about, is that a good goal, right? But Amazon is clear about its goal. Amazon wants to take your money and wants to take it fast. And they have gotten exceptionally good at doing that. And I think the counter example, and the reason I always give this example is, like, sometimes in other sectors like higher ed, we're kind of sitting around waiting for people to get back to us, right? And so I do think there are portions of what these other fields are doing with suggesting getting you to do the thing you're trying to do next really quickly that we can learn from, right? I would argue, and this is my personal opinion, Beth, and we could chat about this another time, but like, I would argue getting a student auto-registered for courses, sending them a pre-populated schedule and saying, hey, this is what we think, given what you took and what you're trying to do, you can always opt out, right? You can all contact us if this doesn't work for you. Do you have a commitment in the middle of the day and you can't take 12 p.m. bio? Let's chat. But at least you're doing a thing that's telling the person on the other end, I want you here, I see you, I'm trying to get you into the classes that you need fastest. We can problem solve on the back end. The problem that so many of the teams eventually realize that they've been doing this whole time is that they have been waiting the students to come to them. And I agree with you, Beth, there's a part of student efficacy in there, but there's also just a part of, like, you know, I could close my eyes and probably say, you're all guilty of sending too much communication to your students. They're just overwhelmed. They don't really understand what needs to be done when, and that you have this requirement. That they don't get that, right? They're kind of just trying to get through their next part of the day. And so the easier you can make it for them, the more likely you will see direction of where you need to go. But I also want to just echo another point you made, Beth, about choice, opting out. Yeah, you can't just design these things where it's like, hey, you have to take bio at 12. Like, maybe this person has childcare issues, right? They can't take afternoon class. You always need to make sure, and I think you guys have already completed the journey mapping and some of the design, right? Like all this kind of stuff. That stuff absolutely has to be a part of it. Any other thoughts, comments, questions, reactions? Okay. We are going to keep going. Sorry. Okay, so I'm going to get into the fundamentals of improvement science. And again, don't worry that we're a little bit behind schedule. I knew this would happen. I have lots of time built in, so don't worry. Fundamentals. And by the way, you will be getting these slides. I think everybody knew that, but I just want to make sure no one's taking notes of everything that is on the slide. Improvement science fundamentals. this is an applied science, right? And it includes lots of different things. And so I gave you the example that NASH is doing and what we're doing through the NIC process. That's a very tangible example, and I wanted to show you kind of like what it looks like. So you have some thoughts in your brain about what this might look like for you, or just generally what it looks like. We're going to go back philosophically really quickly. Improvement science includes the concepts of system thinking, understanding variation, which we covered very quickly today, theory of knowledge, and psychology of change. Those are 4 domains that then get applied to improving the performance of processes, products, systems, services, organizations, and communities. Right? This is kind of the very textbook definition, but I want to make sure we talk about it. The proper application of this science, and I want to be very clear about what I'm saying here, requires the integration of improvement methods and tools, AKA you can't just do one thing. You can't pick one tool that I'm going to talk about today and just go do that. You won't get to improvement. And I just want to be clear and honest with you. Where I have seen people go wrong with improvement science, and I'll get to the tools this afternoon, like, oh, I love driver diagrams. We're just going to driver diagram everything. Nope. You got to use all the tools together. You can't just pick one and go off running. And this is where I see a lot of people go wrong. So I just want to say that because I want to prevent any bad outcomes for you all. Proper set of improvement methods and tools with the knowledge of deep subject matter to develop, test, implement, spread, and scale up changes that lead to improvement. There's a lot in this definition. Don't worry about memorizing it. We're going to get to some of it. I do want to talk about the 4 elements. Appreciation for a system. Really quickly, we're not talking system, higher education system. So just take that out of your mind real quickly. When we talk about a system, we're just acknowledging that a campus, let's take the campus system, for example. A campus isn't just admissions, right? If admissions were just out there admitting students and then going like, okay, well, now you're admitted, and there was no campus facility. There were no dorms. There were no deans of student success. There were no courses, right? Like that's not what we're doing here. We have lots of different departments that come together and form a system, right? The appreciation for a system is the focus of how the parts of the process relate to each other and create a system with a specific aim, right? So let's uncomplicate that. Every college in America has pretty much the same aim. We'll leave the for-profit, online colleges out of this, right? Every college's aim, graduate students, help them on their way. Okay, great. Now, every campus has lots of different parts that contribute to that aim. But here's one question that I always like to ask campuses or folks who are in higher ed. In healthcare, any clinical setting has a chief quality officer, right? Someone who's actually responsible and has to answer to the question, are we meeting our aim? If I walked onto your campuses today and I asked you to point to me, who's the chief quality officer? Who would you point me towards, right? Who would you actually say is fully responsible for making sure that the entire system works? Let's go back to my medication example. When someone dies because there's a medication error, that's the role of the chief quality officer. They come in and they say, okay, where did we go wrong? They do a little investigation and then they say, aha, here's what happened. When the patient told us that they didn't speak English, that little piece of information somehow didn't make it to the pharmacy. How do I fix that, right? Who's that person on your campus? That may not exist. And that's part of the problem in higher education, I would posit, personal opinion, is that we don't necessarily have the structures in place. But this is where you and a good team that you can put together can help, right? Appreciation of the system. Let's understand every single part. And this harkens back, hopefully, to what you did in student journey mapping, right? Like, what are all the steps? How do these people go through this experience? How does that tell us what the system looks like? Understanding variation. I think you caught the gist of it, and the case study gives you a really good example, right? Your departments are doing things fundamentally different from each other, even though you probably have a policy about X, Y, or Z, right? Maybe your policy is like, hey, you have to advise all of our students. They're all doing it very, very, very differently, right? Understanding that variation leads you to understanding where you can find improvement. Theory of knowledge, we're going to get to this a little bit later. It's the appreciation for the need for theory to make predictions to incorporate the scientific method in improvement. AKA, look at your strategic plan, maybe this afternoon over a glass of wine, whatever. Look at your strategic plan. Look at the initiatives that your campus has put forward. Do you understand where those initiatives came from? Do you have a deep understanding of what the theory is that your campus has put forward of how you're going to create change? It's a really great exercise. You might be shocked at what you see. Psychology of change is the last of the four, understanding how the interpersonal and social structures impact performance of a system or process. I've seen a couple comments in the chat that kind of go to this, right? Systems are not servers, right? We're not talking about like plugging something in, plugging something out. Systems are made up of people. If people don't change, your system won't change. That is a core component of understanding the psychology of change. How do you create change? How do you support change? And how do you make sure it actually succeeds? If you don't have an eye towards this, you're a dead man walking, dead man, dead woman, right? Okay, where did these four ideas come from? This is the only person I will put up on the screen today. Edward Deming is often talked about as the grandfather of improvement science. I sort of object because a lot of this stuff has been around for hundreds of years before, but I will say he's one of the most published. If you're really interested in taking a deep dive, you can read some of his books and some of his inspiration. What I will say is he knew how to coin a catchphrase. So you have lots of fun things that he said. In God we trust, all others bring data, right? You can't manage what you don't measure. Probably heard this somewhere before. Without data, you're just another person with an opinion. He seems like he was kind of a cranky guy, but that's okay. And this last one that I love so much is you should not ask questions without knowledge. Basically, ask better questions, right? What are your questions really trying to get at? These are some of my favorite Deming quotes. But Deming's 4 systems of knowledge, you'll hear, if you kind of hang out in the improvement space, you'll hear people talk about it. I want to make sure you know that that's where that came from. 4 elements, sorry. What he basically said with these are the 4 elements, and if you put them together, you create this system of profound knowledge. System of profound knowledge really provides this outside view. This is really the stuff that you and your teammates and everybody else, like this is the stuff we have to learn. You all are the best keepers of how your universities work, what goals you're trying to accomplish. That's where the question that came earlier about, hey, how does this play with our other goals of the students building self-efficacy? You're experts in that. What Deming really brought to the table, and I think I just like to make things concise, is you're that purple square right here. You have subject matter knowledge. You know what you're trying to get done and what your communities need. Where you perhaps need to develop your skills is this green bucket, the system of profound knowledge. Only when the two come together will you have the capability to make improvements. One cannot subsist without the other. And I will also say, it doesn't mean that you have to be both, right? And we'll talk a little bit about how coaching can help you and all that kind of stuff. But his big point, you need both. You can't just be a subject matter expert and say, well, I know all the answers. I did all the research. That's why researchers don't really get stuff done, right? They're out there creating the research. They're out there, looking in the data. They're not usually the best person to come on campus and get a bunch of people working together and doing something. Olivia, I saw you come off mute. Do you have a question? I don't want to roll through.
Sorry, that was an accident. Sorry.
No, you're fine. You're fine. I just don't want to roll through anybody. All right. So getting back, you remember this slide, model for improvement, breakthrough. I just want to review with you the model for improvement. Pretty straightforward. And this is what improvement science should be about. I just want to caveat something, maybe because I'm from this field. This field has overcomplicated itself about 100 times over. And I think one of the best things we can do for people who are new to improvement is make it simple. I like the model for improvement because it's very simple. There are 3 questions followed up by the plan, do, study, act cycle. And we'll go through the whole thing today. But these questions are sequential in order. What are we trying to accomplish? By the way, everybody who's been in the NIC so far has often said, if you take nothing away from being part of improvement work, just start asking this question at the 25-minute mark. in a 60-minute meeting, because what you will realize is most of us spend our time in meetings and on projects where no one's actually super clear on what we're trying to accomplish, right? So what are we trying to accomplish? How will we know that the change is an improvement? And what change can we make that will result in improvement? 3 key questions. Let's take that first one. What are we trying to accomplish? This is codified in improvement science by creating an aim statement. We say aim because someone decided we didn't like goal, whatever, right? What are we trying to accomplish? Aim statements are very similar to other goal statements. Maybe SMART goals is something you're familiar with. You know, these things get rebranded every 5 years. Don't get distracted. What's most important is that the aim statement is well crafted so it has clarity, right? These are the components of a good aim statement. I would suggest that you pay attention to the slide. There will be a quiz later. What will be improved, right? What are we talking about? Just things getting better is not enough, right? I just want to be a better person in the world. That I can't do anything for you, right? Do you want to donate more to charity, right? Like, give me some clear operational definitions about any improvement work that you're starting. For whom? Who are we talking about? Who is your population? Obviously, the transfer work that we are doing is focused on transfer students. Okay, we're clear. This isn't for first-time freshmen. We're not abandoning those folks. We're just being clear that this is who we're working for, right? Sometimes I tell the teams, if you're from a very large institution, you know, maybe you have to decide you're just working on certain colleges, whatever it is, right? You got to scope appropriately. By how much? More is not a number. Later is not a time. Hope is not a strategy. That is also a Deming quote, right? You can't just tell me more. I don't know what more means. Is more 1%? Is more 100%? This is a fun philosophical debate that I always get into with people. People say, okay, Juliet, well, I want to improve. I want 100% of our transfer students to graduate by the year 2030. Obviously, the next question is, well, where are you at now? I don't know. Oops. We're at 40%. But we want to be really bold. You know what being really bold leads to? People not believing that you're actually going to do anything. And I caution you against this, because if you set a goal that is inherently unreachable, people will not take you seriously. Also, if you're hovering at, what did I say, 46%? If your goal is to get to 47, you're not really inspiring anybody to join the cause, right? Real improvement rests somewhere between 3 to 7% over time amongst what we call a general population. So I just say that to say, if you're looking at a large enough population, which we define as about 100,000 students, or 100,000 of anything, people, students, patients, real improvement actually shows up in pretty small numbers. So it doesn't make very much sense when you're crafting an aim statement to say, we're going to get to 100% by 2030, because you're not going to get to 100%. Also, you know, be a little inspirational here and don't give us the like 1%, right? By when? Just saying soon or in the near future, again, you're not giving me a time boundary here, okay? So what does an aim statement look like? This is our transfer success aim statement. We'll read it together and then we can talk about it. By May of 2030, the percentage of in-state students enrolling at two-year institutions who transfer and complete baccalaureate degrees within 6 years will increase by 7%. I have a date. It's by 2030, May. So it looks like spring is in that. I have a really well-defined population, right? It's the in-state students who were enrolled at two-year institutions who transfer and complete their baccalaureate degrees. Okay, I know exactly who I'm talking about. I'm not talking about reverse transfer. Big problem. I can agree. You probably agree. But we're not talking about that here, right? See how these clear operational definitions, they actually start to build just a little wall around you to say, this is what I'm working on. I can acknowledge that first-time students are having a hard time. That's not what I'm working on here. Because guess what? The interventions that first-year students need and the interventions that incoming two-year students, incoming transfer students need are wildly different, right? 6 years, I have a time frame, and I have a very specific goal of 7%. Okay. Oops, those are my arrows. Okay, you guys got it. Aim statements. I want to be really clear because, again, this is one of the things that people get wrong when they launch improvement work. They have to be anchored by an outcome measure. They cannot be a process measure. So just to go back here for a second, right? The outcome measure is completing that bachelor degree by 6 years. If I just said, well, by 2030, we want to increase the amount of students who think that they want to transfer, that's not an outcome measure, that's a process measure. I typically urge people to look at an industry standard measure that is already being reported on and can be easily pulled, right? So this is one example. Obviously, the transfer student graduation rate is something that you all are measuring and you can pull really quickly. One thing that I see a lot is we have this vague goal of improving the student experience. That is not an outcome measure. You cannot measure that for every single student in a systematic way. So we'll talk more about what projects are ripe for improvement and what are not, but things that kind of sound like that are not a good fit for improvement science. Doesn't mean you shouldn't be working on them. I think we could all agree that improving the student experience is a laudable goal. It just means it's not right for improvement, right? So aim statement should also evoke the so what. And sometimes I just ask people, we were in Chicago when we last met, so I used the Chicago Tribune example. What would the headline be, right? If we all got together and worked really hard until 2030, what would the headline be at the top of that article, right? Nick increases transfer student success rates nationally. Okay, that sounds like a headline article in the newspaper. Not a whole bunch of people got together, worked really hard, and some things got better, we think, but we're not sure. Right? Like, that's not clear. You're always looking for this really crisp outcome measure. Really quickly. No, we're not going to go really quickly. We're going to end a little early because we're not going to get it in 9 minutes. Let's end a little early. Let's give everybody a 30 and 9-minute lunch break. Let's stop for questions really quickly before we move on. And then when we come back, we can pick up with driver diagrams. But before we go on, does anyone have questions about aim statements? Let me stop sharing for a second. Or other general comments, questions. I have a lot in the chat that I've not gotten caught up with, but I will not hold you hostage.
I thought
Julia,
Jay's
in my work, we talk a lot about closing the gaps, right? So like when I'm looking at retention or performance gaps for first generation students compared to continuing generation students. And so in my head, I'm trying to like work on what like aim statements are around that, because that looks a little bit different. But so I guess, is there any critique around utilizing, reducing the gap by 5%, that kind of thing versus the example that you presented?
Absolutely, Katie. I think one of the things we can all work really hard on is, and this is where the specific population comes in. I think a lot of fields have gone to using the language of, taking an equity lens to get to, an outcome, a gap to goal, something like that. It's a little it's just a little bit of like different language, but when we talk about specific populations, that is what we're talking, right? So if your campus, I'm just going to take transfer just because it's easy for me, right? When you're looking at your transfer enrollment rates or transfer completion rates, let's say, and you're looking at like, okay, well, 65% of our Hispanic students graduate on time, 14% of our Asian whatever the breakdown is. And then you're saying, yeah, we actually want to do this work very specifically for the students who have historically been left behind. You would put that in your aim statement. So it's just an acknowledgement that I think the language is a little different and people started talking about like setting goals with an equity lens. This is the same thing. We just call it out and talk about what population are you focusing. Does that make sense? Okay. Yeah, Stephanie.
Hello, can you hear me?
We gotcha.
Perfect. Thank you so much, Julia, for the first half of our session so far. I also have printed out whoop, I don't know if that would be helpful to other folks, or hopefully if this is even up to date, but it's like a little Nick's explainer in terms of how the improvement science works and the theory of change. I guess my question is something that I think will be relevant to all of us on this call. And it's something maybe we can talk a little bit more about in the second half as we transition into our practice and our capstone projects, right, where theory meets practice. I heard you speak a little bit earlier about how one of the pitfalls of improvement science is that you'll see folks try to extract or take maybe one tool off to the side, perhaps something that right stuck out the most to them or feels more relevant for their context. And I guess my question is, in reading about the next and the cycles with 3 phases, which typically take, it looks like 15 months in total, we are aiming to work on projects over the course of, let's say, 4 months. So my question would be, is there an opportunity, even when you look at harm reduction, right, borrowing another concept from our friends in the medical field, to implement if you don't necessarily have, again, that time and those resources, right? How can you still get some good work underway so people don't feel too overwhelmed or too turned off or alienated by like, oh gosh, I can't assemble this and commit to like all these cycles. What else can I do? I think that'll be a really interesting conversation to have together.
Absolutely, absolutely. And yes, I will reiterate that the NIC structure is very specific for when you have large groups of teams working together. But like I mentioned, you can do a one-on-one improvement project. You can do a solo improvement project. It is not the time boundaries are 100% malleable. I'll give you an example. I often let my recycling bin overflow, and then I'm frustrated because then it doesn't fit. And then I'm hauling a whole bunch of recyclables down my elevator, whatever. I'm going to run an improvement project for 1 week, just 1 week. And I'm going to use PDSA. And this is the tools that I'll bring you through in the next section. All of the tools fit together like pieces of a Swiss clock. The amount of time you give yourself is more related to the problem itself. For transfer, which is my example in the NIC, transfer obviously maps to the semester cycle, right? So all these teams have been working on something that takes 2 semesters. But the time boundaries, this is an excellent question, Stephanie. The time boundaries are 100% malleable. I could say today is Wednesday, January 15th, and I got to get this recycling thing down. And one of my tests to change is going to be every time I take the elevator down my apartment, I take 1 piece of recycling down. And I'm going to see what that does. And I'm just going to try that for 7 days. I'm going to record some data. And then at the end of 7 days, I have completed my improvement cycle. That is you're going to use all of the same tools. Obviously, this is a little bit of an exaggeration because you're going to see all the tools and go, maybe I don't want to do that. For recycling, you're going to use all the same tools in all of the same linearity for a project that would take you 1 week or 1 year or 10 years. That in some way, I would argue, is the beauty of this method. And I think you guys can probably call into your minds so many of the success or change frameworks rely on, well, you need 3 months of this and you need 6 months of that. And then you need to, right? Continuous improvement is 100% flexible. You have a 12-hour day. I would argue, I don't know how many seconds that is. I'm not a math whiz, right? You have however many times 60 times 12, you have as many cycles as you want, and it is your job to figure out, how do I match the time boundary of the problem to what I can actually do? Excellent question, Stephanie. Great question, and happy to talk more about it in a second. So, any other questions before we let you go to lunch? I know this is that's a dangerous question. All right. We will let you go to lunch. You'll have a half hour. So we'll see you back here at 12:30. I will hop on a couple minutes early. If you have other questions that come to mind, I can be available. Perfect. All right. I linked you all back in the chat. Oops. That's a link to a healthcare article. Let me correct that. There you go. Try that second link. Sorry about that. There you go. All right. So second question, just to bring us all back from lunch. What is one word or phrase that comes to your mind when you think about the concept of improvement? No right or wrong answer. Just want to see where you land with this one before we jump in. Okay, so we've got folks talking about change, making things smoother, progress, asking why. I love that. That's a big tool of improvement. So I love that that came to mind. Smoother processes, focus, making something effective and efficient. Yeah, that's amazing. Focus, I think that's a big one. I saw some notes in the chat over the break around making sure you start small to make sure that there is progress. So I love that. Building on strengths to get even better. That's a good one. Getting better over time. Planning. That's a good one. Self-awareness, personal bias, different competing priorities. Great. Awesome. Well, these are all part of change. So thanks for sharing those. We're going to pick back up from where we left off, talking about aim statements, asking that first question, what are we trying to accomplish? The second question I'm not going to spend a whole lot of time on today. How will we know the change is an improvement? Partially because that relates to the very first question. If you answered the aim statement correctly, you have defined your outcome measure. And measurement in continuous improvement science is a big nut to crack. So we're not going to have the time to cover that today, but we'll show you when I get to some of the examples where that comes in. So I want to jump to the third question. What change can we make that will result in an improvement? That's a big question. And one of the things I'd like to start with is reminding people that all improvement, which is part of where I wanted to ask you what that made you think of, all improvement requires change, right? But not all change will result in improvement. That feels like a parable. It's not. But just to say it again, all improvement requires change, but not all change is an improvement. And that is something that I think we sometimes lose sight of. We try something out, we test something, we invest a lot of time and energy. And this is where, kind of back to my philosophical waxing on governing by press release, it gets hard, right? Because if you put a lot of energy into making a change and it actually doesn't improve anything, you've got egg on your face, right? And so that's partially why we test small, we reduce the risk. This all comes back to making sure that we are really clear that the change that we made actually results in an improvement before we go to scale. So one of the ways that we do this is we start working on one of those 4 areas that Deming laid out for us, which is developing that system of profound knowledge, right? Which is not letting, and I'm sure you all have been in these types of brainstorming meetings, right? When there is a change that's looking to be made or a problem looking to be solved, all of a sudden you've got a lot of people throwing spaghetti at the walls, lots of big ideas, some ideas overlapping, lots of small ideas, and all of a sudden you just kind of end up with that like horrible, list of things, and there's no organization to what it is you're trying to do. And one of the ways we combat that in improvement science is we use these things called driver diagrams. Driver diagrams are living, breathing documents that help us codify what do we know, where are we going, what's our theory of change here? What do we think we can do that's going to have an improvement, right? So this is a driver diagram. The way you read a driver diagram is from left to right, which may feel intuitive, but some people don't necessarily agree. Obviously, on your left-hand side, you have your aim statement. So we covered that in the last little session. Once you've gotten real clear about what your aim is, you're going to pop that aim statement right there. And now you've got a team of people, or maybe it's just you. You're very crystal clear on what your aim is, what you're looking to improve. Okay, great. Now what? Now comes the hard part. You have to break the problem down into smaller pieces. Even my very silly example of my recycling bin is overflowing every single day, that's actually still too big of a problem to understand and to start working on and improving. And just to give you an example, it's, is the problem that my bin is too small? Maybe I forgot to tell you that I'm using a thimble as my recycling bin, right? Well, obviously that's a dumb idea. I need to get a bigger bin, right? But I didn't tell you that. I left out that context. And so maybe you were convinced that, well, it's because Juliet doesn't like to, she forgets the key to the recycling room. And that's what's caused, right? Everybody's bringing their own little idea to what's wrong. And without a way to organize all of that, you're just going to end up in probably an argument, but in the best case scenario, a pile of ideas that you have no way to organize, right? That's the role of a driver diagram. So you start with your aim statement once everyone's clear about what's going on, what problem you're trying to solve, and you start listing out what we call drivers. What are your primary drivers? What are the 2 or 3, 4? I wouldn't go further than 5 primary drivers. What are the things driving the bad outcome that we think if we move to improve these things, we could actually see traction? And then once you list those, unsurprisingly, you're going to unpack those some more and you're going to come out with secondary drivers. And these secondary drivers, they're going to be a little bit more nuanced. They're going to start to dive into, okay, maybe Juliet's problem is she does keep forgetting her key to the recycling room. What are the problems there, right? Maybe she has too many copies of this key. We need to reduce the number of copies she's leaving laying around. Maybe it's because that key isn't on my regular keychain and there's some consolidation that I can do there to make sure I keep it on me at all times, right? Whatever those are, right? But what I want you to be clear about is that you see how that last column is change idea. You're not putting in your driver diagram the actual change idea yet. This is a very tough thing for teams to do at first, is to pull apart your change idea from what is the concept that you're testing against, right? So I'll continue down this very goofy example. Let's say the problem is my key to the recycling room is not on my main keychain. And my change idea is to put my recycling key on my main keychain. That way, whenever I leave my apartment, I have the right key. That's a change idea. The concept is what I would sort of call key consolidation, right? Key management strategies, whatever, right? It's not the change idea and the concept that you are testing against are actually 2 different concepts. Here's why that's important. Let's say that I do put my recycling bin key on my keychain and I test that for 1 week. Does that make me get into the recycling room any faster? And all of a sudden I see that no, it doesn't. Actually, it's not improving the amount of recycling that I am taking out each day. If you don't distinguish the change idea from the change concept, what would you say? You would just say, well, that just doesn't work, right? This whole idea of putting it on the same keychain, just throw it out, right? This is the proverbial, you're going to throw the baby out with the bathwater. When maybe what I needed was actually a key system that was color coordinated to make sure I always know where my recycling key is. As you can tell, this example is pretty silly and it falls apart and it's hard for me to really construct here, but you can see why you need the change idea to be different from the secondary driver. And I'll show you more examples as we go along. But I want to walk you through, this is generally your driver diagram. Now let's get back to the work at NASH, just to give you a tangible example in higher ed. Here's our aim statement. You saw it before, we're throwing it in there. And what we decided when we looked at all of the research was, okay, well, there's actually 2 primary drivers. If you're going to look at transfer student success and making sure that they get, they're enrolling from the 2-year institution at the 4-year institution, and that they are then actually completing their baccalaureate degree within 6 years, you actually only have 2 primary drivers. Your primary driver 1 is that you need more students to make the leap from the 2 to 4-year transfer. From the 2-year institution to the 4-year, what we call the 2 to 4-year transfer rate, right? And you also have the secondary primary driver of you need a transfer in success rate to go up as well, right? Basically meaning if you get more students to enroll in the 4-year institution, you then have to graduate them on time. What I want you to see here is that the reason you have to list out all your primary drivers is that when you look at my aim statement, and let's say you just take away that transfer in success rate, if I just said, we just need to make sure more 2-year students get to the 4-year campus, and we just did that all day long from now until 2030, do you think we would reach our aim? No. You would just have more students at the 4-year institutions. But if you're not at the same time improving the completion rate of those students at the 4-year universities, you're not going to reach your aim, right? So these aren't either or, they're ands, right? And this is where we chose to go with our driver diagram. Like I said, I never recommend more than 4 or 5 primary drivers, because again, these are not your change ideas, right? You're going to stare at this list until you're blue in the face and nothing's going to change. It doesn't matter. It's you providing a strategic way of thinking about this problem. We need more 2-year students to become 4-year students, and we need more 4-year students to complete their degree on time. If I do both of those things and I improve both of those rates over time, we will reach our aim, right? See how it's comprehensive? So here's, that's the primary driver. When we, I'm sorry, there was a point to having that double. When we started our work in the summer of 2022, this was our driver diagram. This is how sparse we came to this work from, right? Then by the fall of 2023, we had tested, remember how I told you about all those tests of change that we had done? We had learned a lot from all of those tests of change about what does it take. So in this diagram, I'm showing you the secondary drivers that we started to see move this 2 to 4-year transfer rate. So you're going to see some stuff that you probably recognize, right? Making sure that prospective student information is shared between 2-year and 4-year institutions, re-engagement of denied 1st-year students who wanted to come to the 4-year, they got denied, and then they started their career at a community college. One of the big things we found out was that no one was reaching back out to these students to say, hey, I know you applied to come here in the first place. Now that you've started your college career, would you like to come back as a transfer student? Same thing for people who were admitted as a 4-year institution, first-time freshmen, but decided for whatever reason, they were going to start their degree journey at a community college. Same thing happened because they didn't accept the offer of admission. No one was communicating with them and saying, hey, we saw that you got started at our local community college. That sounds good. Hey, we'd love to see you in 2 years. Let's stay in contact, right? Reducing the time to submitting the admissions application. This is not rocket science. If students apply faster and submit complete applications faster, you're going to see more of those students come to the 4-year institution. Joint admissions, reducing time to admissions decision. This was a big one. Some of our schools had folks hanging out waiting for over 100 days for an admissions decision. It will not blow your minds to say that when they reduced that to 10 or 7 days, they saw more students enroll, right? This is not rocket science, but you got to make sure that you're doing these things and you're improving on these key secondary drivers. Reducing time from admissions to acceptance, pre-matriculation advising. You guys get the point. You can kind of see where we went here. These were our secondary drivers for our second primary driver. What I want to show you is this is where we are today. So that was 1 year ago. Every time the colors change on the driver diagram, it just means 1 whole year has gone by. And this is where we are today. We have 12 secondary drivers for primary driver 1, and we have 7 secondary drivers for primary driver 2. And from all of the testing that we're doing, the more testing we do, the more knowledge we create, we are clearer and clearer about what campuses need to do to get to improvement. So that is what a driver diagram is supposed to do. Now, I want to get some help from you all. So hopefully you were paying attention in our last 2 modules, and I'm just going to need some volunteers because this is a driver diagram that I put together, and I would love to hear your feedback on what did I get right? What did I get wrong? What would you change? So I'm going to keep this up here. I'm going to grow my view of all of you. And I'd love for someone to tell me what they think could be done with this driver diagram to improve it. Maybe starting all the way at the left hand with our aim statement. Remember how I said there would be a quiz on aim statements.
So how much is more?
Oh, how much is more? Okay, so Maggie, you're telling me that walk more each day is not a great aim statement. Is that what I'm hearing?
Correct. So we want to
Okay.
do walk 8,000 steps a day or whatever.
Perfect. I love it. I'm going to steal it completely. Oh, sorry. I've got to bounce out of presentation mode. Here we go. All right. I hope you guys can see that, even if it's. Okay, here we go. All right. So we're going to go with that. Oops. Walk 8,000 steps a day. Okay. Am I done? Is this a good aim statement?
Maybe we need like a time period, right? Like for the next 2 months, because is this like every day for the rest of your life? Because, good luck.
Okay. I love that. Oh no, wait, we're not saying for the rest of your life. For the next 2 months. Okay. Do we feel good about this aim statement? Anything else missing?
Where are you starting? Like, is 8,000 an increase from where you are? So you're gonna increase to 8,000 steps a day? Or
Great.
where are you starting?
Yep, I love that. So in improvement language, we call that the direction of goodness, right? Like, what's the direction of goodness? Am I trying to go up? Am I trying to go down? So we're just going to make this up and say, increase my, we're going to make up a measure, daily step count. From, let's say I'm really lazy, 1,000 to 8,000 steps a day for the next 2 months. Is that good enough?
It would be, if you're gonna do an increase like that, it wouldn't be for the next 2 months. It would be by the end of 2 months.
Ah, I love that.
You're not gonna suddenly go from 1K to 8K.
Yeah, we won't wordsmith it, but you guys get it. Great point. I don't know who made it, but excellent point. The difference between when is this actually going to happen? So now I'm being really clear that I've got to increase my daily step count that's currently at 1,000. I got to get to 8,000 steps a day by the end of the next 2 months. This gets, I think, very nicely back to Stephanie's question right before the break, right? I've decided it's a 2 month. I got to get to that. I mean, we'll make something up. I have surgery in 2 months, and this is a directive from my doctor. Whatever. Anything else you want to add to our aim statement? It's possible. I like it. All right. Let's jump over to our primary drivers. So I have said there's 2 primary drivers. My first primary driver is to set an Apple Watch to 10,000. We'll move this to 8,000 steps per day as a goal and close my rings each day. And my second primary driver is allocate 60 minutes per day for walking. I'll share my secondary drivers because I think it's helpful to do all these at once. So my primary driver is set my Apple Watch. My secondary driver is use personal tracker device to measure my daily activity. And then my change ideas are set watch reminders to go off every hour, and then set an alarm at 9 a.m., 12 p.m., and 3 p.m. to look at my step count. So this is, sort of top driver 1. Driver 2 is allocate 60 minutes per day for walking. My secondary driver that comes off of that is schedule time for walking. My change ideas are extend my lunch break from 30 to 60 minutes to include a walk, And my other change idea is find a friend at work to walk with me 2 times per week. Who wants to take a crack at our drivers here?
I don't know about closing all of your rings each day. Isn't there just one ring for walking? And then there's like cardio ring. And so that might be a little too broad.
Ah, so there's multiple change ideas all smushed into one here. Yeah, because there's a stand goal, right? Stand goal, how does my stand goal impact, what I'm trying to get done here? Great point. What else?
Isn't the use the personal tracker device more of a primary driver, and what you have as your primary is more your secondary? Don't you get more specific as you go down?
Absolutely. And this is the danger of doing this live. Excellent point. Oh. And
So
I
your
didn't catch
first one is you're going to actually use a personal tracker.
Exactly.
Then it's how you're going to use it. Yes?
That's exactly right. And once I find this text box, should have known I shouldn't have done this live. That's all right. We're all in this together. Here we go. Oh, it's an order thing. Well, you guys get it. Here we go. Excellent point. Excellent point. This is really important. Making sure that the primary and the secondary drivers aren't all over the place. The primary driver is, yeah, I need something to measure. I need something to keep me accountable, right? You could say this in a whole bunch of different ways. Then from there, that's your big idea. Your smaller idea is, okay, you're not just going to look at it every 4 minutes. You're going to set it to steps per day. And as Laura, you identified, you got to not include 16 different things, right? Because now I'm getting confused, because what if, to take this to the extreme, you close your step count, but you didn't close your stand goal? Well, who cares about that, right? You squish too many things. So excellent idea. We're going to reduce it down to, you're going to set the Apple Watch to 8,000 steps per day. Okay, while we're on the top half, any comments about our change ideas? Thoughts on our change ideas coming off this one? Are they good? No change? Okay. Sounds good. So we're going to look at the watch every hour. Ideally, look at the step count, and then we're also going to look at it 3 times a day. Hey, whatever. These are change ideas. You'll test them. You'll see if this makes a difference, or if you just end up snoozing that alarm, like so many of us snooze our alarm clocks in the morning, right? But you'll figure it out. You don't know what will work until you know. All right. Let's go down to the bottom half. What's going on here? What are your ideas to improve this driver diagram?
Well, I think again we have they're backwards. The orange and the green are backwards. And perhaps I'm getting too in the weeds about this, which my team will tell you is a danger of working with me. But what I'm seeing through all of this is not really and maybe it's not the place, but just not really kind of an understanding of like why it's not already currently happening. Like when we say we're just going to schedule 60 minutes to go for a walk, like where in your schedule do you have 60 minutes to do that? Is that a reasonable amount of time? Why do you need 60 minutes to get, like, does it have to be in that big of a chunk? Things like that. And so I guess I don't know where that fits in, but just overall, that's where I'm kind of coming from as I look at this, of like set watch reminders to go off every hour. Okay, that's going to get real annoying real quick. How long is that sustainable for? Like things like that is kind of where my brain is going.
Yep. Nope. Your brain is going exactly in the right place, Emily, right? And that's why we want to put it all on one diagram to exactly, because it's all mishmash in your brain, right? Because if someone says, okay, you're going to use an Apple Watch, okay, that sounds like a good idea. An alarm clock every year, oh, that's going to drive me bonkers, right? But maybe, Emily, that drives you bonkers, but maybe Laura's like, no, that is what I need, right? This is why we differentiate the change idea from the driver, because the drivers stay the same no matter who you are, right? Let me just pull up an example in higher ed, right? Reducing time to transfer admission decision. I'm just going to pick on this guy right here, 1.6. That is a general idea, right? We had Texas A&M College Station, home to 70,000 students a year, test this in a very specific way. We also had Shippensburg University in Pennsylvania, home to 1,200 students, test it in a very different way. I don't care how you do it. This is why I really am always really clear. The change idea and the concept are two different things. The concept becomes universal, right? Checking on the status of your steps as you go throughout the day, that's a universal concept that I think pretty much everybody could agree. And we're gonna, extend the metaphor, Emily. And the literature tells us it's a good idea. But Emily does not want an alarm every hour. Laura, that's what's gonna keep her motivated, right? So the change idea, hyper personal. The drivers are universal, and they help orient the campuses, the teams to like, oh, okay, I got to get to this 8,000 step count. How am I going to do it? What works for me? Obviously, to get into like more tangible examples, maybe we'll, go back to here. Everyone's using a different student management system. Everyone's using, some people are using Slate. Some people are using Starfish. Some people are still sending, snail mail and pigeons, whatever. I don't care how you do it. I need you to reduce the time to make those decisions, right? So that's the importance of a well thought out process map and why, driver diagram, and why we constantly come back to these, right? The other example I will give you is just because, and maybe I'll go with this one, right? The every hour versus 3 times. Maybe you test both of these and over time you realize one of them works for you and one of them doesn't. You can just take the change idea off the table, but you always keep the drivers and you're watching how the drivers move your secondary drivers, move your primary drivers, move you towards your aim, right? That's the order of operations. The change ideas, that's always going to be a fluid mix of what good idea, what bad idea. Hey, all of a sudden we're no longer using Slate. We can't text students anymore. Okay, we have to go back to pigeons, right? Whatever, those things are going to constantly change underneath you, and no one can keep that still. What we can keep still is the concept is we have to know where we are during the day against our 8K goal. So Emily, excellent reflections. You guys get the point. I'm not going to belabor it. There's a couple of tools in your toolkit here that I have for you. There are 2 videos that the IHI does. They're open school, which just means that they're available to you. There are a couple downloads. There's a great article that I highly recommend you read called What's Your Theory? It's about 4 pages long. It's nothing crazy. It's not academic. It's very straightforward. And then I have also linked you to a deck on driver diagrams. They will include, you'll get everything because you'll get the PowerPoint, but they include the specific transfer ones if that is of interest to you. So you'll get all of these links when you get the PowerPoint. So don't worry about that. All right, if I hit this, what happens? Yeah, I think you guys still see my screen. Okay. Next, let's move on to process mapping. So got a lot of tools I want to share with you. Process mapping is your next tool. So now you've got this general idea of like, okay, what are all the things I got to eventually get to or improve upon? The next question, and this is really where you were going, Emily, as well with your question. So this was great. I should have paid you for that transition is, okay, now I have a general mental map of all the things. What's going on in my house? What's going on in my campus? And back to Katie's point, what's going on in this department that I have decided I want to work on? What's going on for my African-American male population? Because that's who I've decided I need to really do some improvement work on, right? Whatever your scale is, driver diagram is everybody, that's the universe. All of a sudden process map becomes, okay, what's happening specifically, right? A process map is kind of exactly what it sounds like. It's a visual display of the exact steps within any process and the individuals and groups responsible for every step. I know you guys have done student journey mapping, and I just want to make a call out. In some journey mapping exercises, you're actually doing what's called an ideal state map, AKA, what do I wish this would feel like to people? What do I wish the steps were? Process mapping is very specifically about what is going on today, right? It's very clearly not how I wish things happened, very clearly exactly what happens today. By visualizing how the entire process works, this is where you're going to start to find those inefficiencies, duplication, variation, unnecessary steps. This is where you are going, Emily, is like, okay, so someone said it was, 60 minutes. What is it right now? Do we give everybody a 30-minute lunch break? Well, then that's not going to work for us. Whatever. These are terrible examples, but you get it. Process mapping should be used anytime you're focusing on a specific process, especially if you have identified this process as being unclear or inconsistent. Very famous, we always say all models are wrong, but some are useful. That is what a process map is. It will always be incomplete because you're going to have this one rogue academic advisor who's doing something really goofy, right? But your work is to get your process map as accurate as possible, so that way you can start to ask questions of the data that underlies all of this and say, where should we begin with our improvement, right? Not rocket science, but I love providing very clear instructions. Process map, you have to identify the process you want to map and state it at the top of the chart. This is a non-negotiable. We really can't do without it. You need to identify what starts a particular process. What is the triggering event and what is the end of the event? What is the end of the map? Most often people forget to just label the triggering event. So don't worry about the end of the map so much, but really focus on what starts this whole process, right? You need to define each step of the process in enough detail that every single person in the room can understand it. Absolutely no jargon. Absolutely no acronyms. Because I guarantee you the second you start putting acronyms on your process map, you're alienating people from the conversation because nobody actually knows what Form 1113 is, but they're too embarrassed to say it in your meeting. So don't say 1114, just say student course change sheet, whatever, right? When you're doing this in person, I highly encourage teams to do this in real life. Yes, you can do it virtually. You will notice that the tool that we are using for this today, this is called LucidSpark. This is a specific sophisticated software that is designed to do process mapping. It's very fancy. You get to start doing things like this where you can connect one thing to another, make pretty charts. Do not start here. I absolutely advocate that you start with sticky notes and just blank sheets of paper up on a wall. Butcher paper is great for this. Anything. Because what I want you guys to learn is how to break down a process into each step. And when you do it digitally first, you tend to lose the team's focus on making sure that every single step is notated. And when you hand somebody a sticky note and you say only one sticky note per step, you have a higher likelihood of getting people to understand what you're doing. You can always move to digital later, but start with paper and pencil, right? I have some other rules here. I'll let you look at those on yourselves. Okay, this is what a process map ends up looking like. This is obviously fully digitized. This process map took a team. This is a clinical example that I worked on. This took a team of doctors, nurses, clinicians, public health experts, just about 2 years to agree on. And the process that you see mapped before you is the well child visit process. And this is something you're going to run into because you and maybe, your work bestie, you're going to sit down and do a process map and it's going to have a bunch of stickers. And then what I want you to do is I want you to expand the group. Ask another 3 or 4 people to come into the room with you, look at the process map and say, what's wrong? What's missing? The more people you add to the activity, the more accurate your process map becomes, but the more complicated and the more time you're going to take. That's okay, right? This is always the example I use. If you create a process map that looks like this, where there's like 3 or 4 steps, you know that you're doing it wrong, right? Because this is not enough information for me to understand where I can find improvement. I need what is actually these steps in making a peanut butter and jelly sandwich. I need a process map like this to be able to tell where can I find efficiency, where can I reduce duplication, right? So there's some key questions that you can keep in mind. You'll have these slides. I highly suggest that this is something that you can start working with your teams before you select what area of improvement you want to work in. This is, once again, one of the bigger, I would say, challenges that people have in improvement work is they jump into fixing something because it's their own personal pet project. Make sure you're doing process maps before you choose a very specific area. I have some other questions that you can ask your team before we move on to degree of belief. Any questions about process mapping or how to do this, or the driver diagram, I should say, for that matter? Anything else before we move on to some other tools? No? Okay. We'll have time at the end for questions too, don't worry. Okay, moving on to testing and degree of belief. So now you have your driver diagram. You've now done your process map, so you understand what you want to test against. You've decided. Now you need to move to testing. Testing, as we talked about earlier, is all about building knowledge while minimizing risk. But you need to decide what to test, and this can be tricky. You have the tools, the process map, the key driver, the theory of change, best available data. You have these things to support you. But I want to address the other sort of non-data backed part of improvement effort. And we call this the degree of belief. This is Stewart's term. What it really refers to is when you look at that driver diagram or you look at your process map, you also need to take a little bit of a gut check with your team or yourself and say, what change idea do you think, based on your knowledge of the system, ideally you are close to the problem and so you understand what's going on day in, day out in your clinical settings, what do I think would have the greatest chance of succeeding, right? The truth is, humans don't attempt things that they don't think that they're going to have success with, right? I did not wake up this morning and try to run a marathon because I don't think I would have any success at that, right? And this concept is called the degree of belief. And you have degree of belief in ideas. And this is really the core concept here. When you're making a prediction or a hypothesis, you have some level of degree of belief that you are correct. And I like to just say low, medium, high, right? Let's not get too technical here. Your 2 considerations about how do I know if I have a high degree of belief or not. The first is, to what extent does your prediction supported by evidence? And when I say evidence, I just mean the data, right? Like maybe we're thinking back about, well, we need to admit students sooner. Well, my gut tells me that asking students to hang out in the admissions queue for over 100 days is not really leading to good outcomes. Okay, great. That feels like a good hunch that we can test against, right? Sometimes when we look at interventions that are more, that are coming from research, the big question I would ask yourself is, what is the similarity between the conditions under which the evidence was obtained and the conditions under which your prediction applies? That's a fancy way of saying, just because Texas A&M College Station with 70,000 students did it one way, if you're a small local college with maybe only 2,000 students in each class, don't assume that what a giant Research One institution did and got results from is going to work for you, right? Make sure that you're understanding the differences in the conditions, right? Your Also remembering that in these early stages of testing, you are testing a change, you are not implementing a change. I know this is a hard one because we use the word implementation. It just gets thrown around a lot in daily use. Testing is about learning if that change will result in an improvement. Remember that 70% of change ideas are not good ones, right? So you got to know, you got to assume that some of the change ideas that you're going to try are not going to lead to improvement. That's okay. You just set that one aside, try something else, right? Implementation is a totally different thing. Implementation is about how to make that change an integral part of the system. Go back to the case study that I shared from Shippensburg. Remember, they tested and they tested and they tested this new way of doing registration. And it was only once they had tried it across their entire campus, then they got to implementation. That's the difference between change and implementation. It's a tough verbiage problem because people say implementation for everything and they don't mean it. But in improvement science, we're always very strict about this difference. The common mistake is to go straight from implementation and skip testing. The other mistake that I see is we see somebody test something on a very small scale, and then it worked for those 5 or 10 students, and then they say, well, we're ready to go to scale. You're not ready to go to scale, because it turns out that you only tested that on students who are in the business school, and that, for whatever reason, that curriculum, that degree program is very different from engineering, teacher education, whatever, and you're going to get to failure, right? So just remember that you're doing multiple tests. That's what these circles are for. You're not doing one test and then going to implementation. What this gives you is a map as you do sequential testing to understand at what point am I ready to implement my project, right? So I just drew 3 examples. I had 3 projects that I wanted, or 3 tests of change that I wanted to test. I developed my change and I rated them. This one I rated low, this one I rated medium, this one I rated high. Then I started testing right here in this middle. So I tested, and look what happened. The one that I was so convinced was the right thing to do, at the end of a couple cycles of testing, I realized this just doesn't work. This just isn't the thing I needed, right? This one, on the other hand, I was kind of sold on, but maybe wasn't really convinced my degree of belief was high. But over time, as I tested and tested and tested, I got to a really high degree of belief. Same thing with this blue one. I wasn't sold on it, but you know what? I started testing it and my degree of belief is moving up. What does this tell you? Every time you test, every time you come out of a testing cycle, you're going to reassess where you are with your degree of belief, right? Obviously, this orange line, that's an unsuccessful change. I'm just going to leave that one alone. I'm not going to do anything with it. This blue line, yeah, I mean, it might be onto something, but I need to test it again and maybe make sure that I really believe it has a high degree of belief. Whereas this green one, that is a successful change. It's ready for implementation. So these are ways you manage the knowledge that you are working on over time. It is a way to manage this key concept that all improvement requires change. Not all change will result in an improvement, and you have to have an eye to that. You've picked your change idea. You know what you want to do. We now move into the cycle of continuous improvement. I add rapid cycle on this because I think, as we were talking earlier, too many people think that 1 year is perhaps a good time frame to do a PDSA. The key, the secret that unlocks all of improvement science, and I'll tell you it for the low price of free, the smaller you make your testing cycles, the more you learn. So if you do 4 cycles in a year, you're going to learn a lot. If you do 8 cycles, you're going to learn twice as much. If you do 365 cycles, you're going to learn a lot. So the amount of time, shrinking how fast you do the tests, really accelerates your learning, right? That's why I always add rapid cycle at the top. All right, what is a test? It is not research. That is the first and biggest rule of testing, is this is not research. Nothing you do in any of your improvement science work requires IRB approval, right? This is not research. We are trying to understand what works on our campuses. We're not trying to create new knowledge. You're not doing an assessment or an evaluation. You're not creating new policy. You're not creating a training program or a communication campaign. This is the number one thing I see where teams fall right out of the gate. We actually have a great process. It's that students don't know about it. And so what we're going to do is over communicate to our students about the current broken process, right? You ever been at a coffee shop and there's that sign that just says coffee, do stupid things faster? That's what this is. If you just do more communication without fixing the underlying broken problem, you're not going to get anywhere, right? So you're testing against, I'm making the process different, and I'm seeing if students get there faster. I'm seeing, can I reduce the number of days to giving an admissions decision? What does that do? Do students reply faster? Maybe yes, maybe no, right? But just be really clear on that. If there's anybody who did undergraduate or graduate students, graduate studies in science, you're maybe saying to yourself, this sounds a whole lot like the scientific method. It is. I want to be clear with you. This is just an action-oriented model of the scientific model. Plan, very obvious. You're going to take time. And when I say plan, I want you to spend less than 2 hours on a plan, right? Whatever that other famous quote is, we make plan and God laughs or something. We all know that, right? I don't want you spending 16 days creating a plan. You don't need more than a few hours to create a very clear plan of what you're going to test. You have your objective. You're going to plan out who's going to do what, when, and where, and you're going to create a plan for data collection. Don't worry, I have a plan template for you to use. Okay, now that you've spent 2 hours making your plan, you jump into the do, right? As I mentioned, in our NIC cycle, you only have 45 days to test your change. That's the do cycle. That's where all the good stuff happens. That's where all of the learnings happen. You're going to continuously come back to your action plan, cross things out. Yeah, that didn't work as planned. Registrar got really mad at us, so we're going to do it some other way, right? All of that is going to get captured in your action plan. And that's where you're going to collect your data for analysis. At the end of your cycle, let's just call it 45 days, you are going to be able to look at your data and say, was this change an improvement or not? This is important because you need a baseline from which you should be able to compare. Then, once you've done all of that, you can get into the ACT phase. ACT is very simple. You're going to look at your data, you're going to talk with your team, and you're going to make one of 3 decisions. Do we adopt, adapt, or abandon? Adopt means, yep, this worked great. Remember that 80% rule? This worked for 80% of the students that we tried it on. We need to adopt it. We need to try more students. We need to add another department. We need to go a little bit bigger. Great. Adapt is, yeah, this worked and we're on to something, but we need to tweak it. It turns out advisors are not the best individuals to call students. We need peer advisors, whatever, right? You're going to tweak it a little bit and retest it. That is not an adoption. That's an adaptation, right? You're changing the change idea itself. You're adapting it. Abandon is pretty simple. It didn't work, or you went in the wrong direction. Everyone's mad at you, but don't worry. You only tried it on 5 students. So you're going to buy 5 people a cup of coffee and move on with your life. That's abandon. The reason we document all of this is because at one point in time, you will leave your job at your university. And if you do not leave behind a series of tests where you actually write out what you did, what the data told you, and that you stopped doing it, that poor schmuck who takes your job is going to go back and try the same thing over and over again. See how we're building systems of learning for ourselves and our peers? This is a really important part of the process. Your PDSA needs structure. This is the other thing this is the hill that I will die on one day. Just giving people this circle and saying best wishes is not enough. You will get my template for a PDSA plan. There's about 100 different variations of this. The IHI has its own template. You can iterate off of it. It's part of the infrastructure. But what I would say is that you cannot do more The absolute limit is a 90-day cycle. Do not allow anybody, yourself included, to test something more than 90 days. 90 days is just this weird artificial human limit. Like, we lose interest in things after 90 days. Just go smaller than that. Remember what I said about shrinking the size of the test will increase how much you learn. Never go past 90 days. If you're doing this with a team, and this isn't just your one-on-one recycling plan that I apparently have set myself on, you need at least weekly or bi-weekly check-ins, because same thing, everyone's really busy. If you're not checking in with your team, you're doomed for success. I will also just put out there that I have not seen really great improvement without coaching support. And so finding a way to get some of that coaching. You have folks in your state who have been through some NASH programs. You have access to some other supports. Finding someone who can coach you to becoming really competent in these core skills is really, really important, because otherwise it will be hard to find success in all of this. And lastly, I will just say the hardest part of PDSAs for anybody starting out is the measurement. And most teams need a lot of measurement support to answer that key question. How do we know that this change was an improvement? It's just not something that comes naturally to people. I'm going to go through these next couple slides very quickly. These are more food for thought. I want to be very clear with you is there's a lot of us who caught the bug of improvement science, and then we end up being a hammer and everything looks like a nail. Improvement science is not the answer to all of your problems. I have included 2 process diagrams, that the IHI has created. And this helps you see the linearity of how you go about improvement work. I hope these are helpful to you. These are, obviously they come from healthcare, but you can see identifying the opportunity for improvement, organizing a team, making sure you understand the problem. This bucket right here, is the process standardized? If you do not, if the answer is no, you do not pass go, you do not collect $200. What I mean by that is where improvement work tends to fall flat is when someone says, I want to start transfer student orientation. You can't improve something that doesn't exist yet. That's not a fit for improvement science. You may need separately outside of improvement work to start an orientation process for transfer students. I'm not here to say no to that. What I am here to say no to is if there's not a standard process that exists, you can't improve it. So if the answer is no, you get that box of standardize the process and come back, right? So make sure this question does not go unanswered. This is where 80% of people fall down. So I just want to be super candid with you all. Then, yes, this standard is standardized, just making something up. The admissions review process, very standardized. Okay, great. You need to identify potential measures. How will we know? Number of days to getting an answer to a student. Great, perfect. You need to follow the entire flow chart before you get to the second half of the flow chart, which is what we ran through today, right? Selecting your ideas for change. We talked about that. Run your PDSA. We just covered that. Collect the data. Did your ideas have the desired impact? No. Go back to the beginning. Yes. Okay. Now you do sequential testing. Oops. Now you get to implementation and some of these other things. Okay. So these 2 flow charts, super important. I've also included a couple other pieces here about selecting topics. Again, this is where 80% of people just get it wrong, which is not your fault, but I just want to be very clear. Other items to consider. Is the topic or problem of practice, sometimes we call it that, something that matters to the goal of the organization, right? You can't pick something that just doesn't really match with what the institution is trying to accomplish. If that would just be considered out of scope, right? So I don't even have a good example. I think you guys get my point. It has to be within the strategic direction of the organization. Otherwise, you're off to a bad start. The second question I always ask people is someone's job on the line? That's a very dramatic question, but if you focus on something that only matters to like one person, right? Fixing the filing system of the registrar's office files, like no one cares about that but the registrar, right? You're not going to get the buy-in. You're not going to get the energy. You need something where someone's got skin in the game, right? For transfer students, obviously increasing transfer student enrollment. I would argue that whoever's your head of enrollment management, whoever's your head of transfer student success, whatever that position is on your campus, that really matters. And that's going to get traction, right? Once again, is the problem related to a process that has adequate flow, right? I just gave you the example of improving orientation. Bad idea, right? Does current performance or campus performance vary from best available knowledge? This is sometimes a hard question to answer in higher ed. So I'll just, name that for you. For example, yeah, how fast do we turn around transfer student admit decisions? There's no federal registry that helps you realize, are you faster or slower than your competitors? However, I would say to you, you can just look at your transfer success rates and you can compare that to other campuses to see if that's a place you want to start. Organizing a team, that's that next bullet that you saw. It's really important that you organize a team well. This is the absolute minimum. You need an executive sponsor. You need someone at the organization who cares about this topic. Ideally, this is the person in that last slide whose job is on the line. So that way they can be really on top of it. They can help you remove any barriers that you come up against. You need a team lead. So much of this comes down to leadership and being able to manage these processes. You need team members. And as I mentioned before, you really do need improvement coaches and supports. The last thing I will say before we really wrap up, and I kind of want to hear where you're thinking of going, is no one is ever really ready to launch improvement work. So don't get too wound up about it. The best place to start is today, right? But there are some things that you cannot do to avoid chaos and failure. My advice to you is also start engaging with an established format. That's why I talk a lot about the NIC. If you haven't had exposure or training in improvement science, I often suggest that people join things like that to get a taste of it, see how it works for you. I know there's a secondary NIC that's happening in Kentucky. Any of those structures will allow you to get coaching, and you can also talk to Chris and Amy who are in your cohort about their experience. And I hope they would back me up in saying it's helpful to have a structure and coaching. And then over time, once you have developed your own skills, that's when you can really lead your own work. Working with an experienced coach, I learned this trade from other great coaches. Thank you, Chris. I appreciate that. This is not something that you learn in a day. And so really working with an experienced coach can help you, again, avoid those pitfalls and just learn quickly. And then hopefully in an ideal world, get even better than your coach. That's the point. And lastly, I would say this has to be a coalition of the willing. You have to work on improvement projects with people who both agree that there is a problem and want to solve the problem. Do not go to the crustiest dean on your campus and try and get him or her to change their ways, right? You want to start with the coalition of the willing, other people on campus who have the same kind of excitement about the problem. You typically know who these people are. You don't need to do a whole lot of soul searching. Make sure you start with the coalition of the willing. I know we were short on time. These are just reminder slides. What I did want to do was have a little bit of a conversation, and Lily and your team, Stephanie, and others, you'll have to keep me honest on how much time we can squeeze from you. But I would love to hear or just take any questions or thoughts you have about how you think some of this, all of this bleeds into what you're trying to do. Where would you start? What questions do you have about implementation? Let's open the floor up for a little bit of chit chat. Hopefully, Lily, we can spare a few minutes. Because I'd love to hear from you guys.
I have a question. So
Yeah.
we're talking about the testing phase and you want lots of short tests. But if your goal is to improve success, to improve retention, then you don't get results until the end of a semester or the next year. So how do you do a 90-day test when your goals are that broad? I mean, those are time-based. I'm not wrapping my head around this well.
Yep. No, great question. Great question. And this is where I would go back to, and let me actually go back to, I think an illustration helps. This is where we would go back to the driver diagram, and this is the importance of breaking down the problem. Here, let me re-share. Okay, so okay, let me use the secondary driver because I think that this speaks more to your point. So I know we spent a lot of time in the first driver. Let's talk about the secondary driver. Transfer in success rate, exactly to your point. Excellent question. This takes time. So even from the moment a 2-year student transfers in, you're at least 2 years away from that completion, right? What's important is over time as you test, you're not actually testing against this measure. You're tracking it. And of course, over time, you're tracking it and making sure that you're going in the right direction. But what you're actually testing against, oh my goodness. And I'll just pick on 2.4. You're testing on something that has a smaller time scale, right? So the retention of academically at-risk transfer students. This is actually, a lot of this work was done by Cal State. That was just an area of focus they had, because when they looked at their data, when they did their process map, like A to Z, and then they looked at their data and said, okay, where are students falling through the cracks at Cal State the most, transfer students? What they saw was that they were losing a bunch of their academically at-risk transfer students. And basically the process, and maybe it's the same, but basically their process was, at the end of one semester, transfer students would get this, demarcation of you're academically at risk, and you needed to complete certain activities or enroll in certain classes to be able to come back that next semester. And what they found was they were losing a bunch of students there that they didn't need to lose. And so, yes, they're working on the general concept of completion. But what they were really working on was, if we can grab more students from from fall first semester as a transfer student to spring second semester, if that number goes up, we're going to see the completion rate go up. Does that kind of make sense?
It does. It's just very difficult. I mean, like, I could kind of see trying an intervention and just measuring it against a performance by midterm. Like, as an indicator.
Yep.
But that still wouldn't ultimately give me confirmation that the change was effective for my large goal.
Yep.
So
Now, yep. No, you're 100% right. Here's maybe what I haven't talked too much about. These secondary drivers, in an ideal world, you're pulling this from what we call is a change package, which has been tested before. An alternative to a change package is also looking at literature, right? And saying, okay, what does the literature tell us we know will move that dial, right? So
yeah, that's kind of where I was going. If we had indicators that said students who miss a day in the first 3 weeks have a greater likelihood of not being successful.
Yep.
Then we can focus on just those first 3 weeks, and then we can get a shorter. So it's looking for those other smaller stepstones that have been shown to. Okay.
That's exactly it. And I want to name something that you're calling out. One of the biggest differences I see between the healthcare sector and higher ed is we have reams of these intermediary measures, right? We have so many, we sometimes don't know what to do with them. Higher ed is lacking in this. Higher ed has a very standard measure set for outcomes, right? When we say 6-year graduation rate, we all kind of know what we mean. But I just want to call out something because there is an inherent tension, and that's why your question is such a good one. There isn't a really great, like if you just Google, right, like what are the secondary measures that would drive transfer in success rate? You're not going to find this treasure trove of them, right? And so part of what we're doing at Nash is building them, right? And when you look at the driver diagrams, what you're going to see in our more detailed reports is you'll actually see how many times each of those drivers were tested against and how many of those tests drove improvement. And that's how we're actually creating this new measure set, which, by the way, will be available to the field. That's not something Nash is trying to gatekeep. We're going to make it public. It's coming out in February, at least for transfer success, where we're going to say, hey, look, we ran hundreds and hundreds of tests. And here's the thing. If you reduce the time from admissions, application completion to student awareness, this is what we saw happen to enrollment multiple times in multiple contexts. And so we can stand behind this to say, because Kashan, that's what you're looking for, right? Is like, what smaller measure do I need to act against? So great question. You're exactly right in your thinking. And I just want to provide that context that I wish higher ed had a great measure set to hand to you. Be aware that depending on where you are doing improvement work, you may or may not have that available to you.
So we can make them up as we go?
Absolutely.
Now we are in the scientific method, I think.
Absolutely. There it is, right? It's just like test and test and test and test. And this is why, just to get to my other point about like, why are NICS networks important? Because remember how I said you can shrink shrink the test, the time, to your point. And this is why we run on 14 months. We can't shrink the time that much. Like we have to wait for at least a semester to go by.
Exactly.
So that's why having so many teams from so many different states all focused, it creates knowledge hyper fast. And then we can just stop with the stuff that doesn't work. And then we just go forward with the stuff that we're finding out. You're 100% right. Your brain's absolutely in the right place.
Thank you.
Sure. Any other questions? I don't want to hog too much of the rest of the time, but any burning questions or thoughts? I'd also invite maybe Amy or Chris. I don't know if there's anything you'd want to share about your experience in the NIC that I haven't captured. I know this was a lot of information. I will say that this is like drinking from a fire hose, but I don't know if there's anything else I missed that you would want your colleagues to know about.
I mean, the one thing we always talked about is a lot of times the first time you do it, it's really not a test to change. You're going to end up doing stuff and it's just going to be things you should have done or wanted to do and didn't have time to do it. Or it was more just an action rather than changing something. So understand the first couple of times you do it, it's probably not correct.
I would echo Chris. He has been in the cycle or was in the cycle a lot longer than we have been. We haven't even been in a year yet. So that, and it helps when there's people on your team that can get quicker answers than you. And that can, because of the hierarchy or the position in which they reside at, they're able to make decisions themselves, because that will help move these small tests of change on quicker, so you can, run them and test them out, and then, get back together and reassess if things aren't going the way you planned.
All right.
Julia,
I'll
I
hand
have
it
a
back
quick
to you, Lily. Yeah,
question.
please.
You mentioned that tests of change or continuous improvement is, especially when you're kind of just starting out doing it, is most often like it's very helpful to have coaching support for that. And so
just curious, what that looks like, that, what kind of parts of coaching support have you seen to be most important for change?
Yeah. Great question. I think the most important part, and I think it's actually where Chris and Amy went, is, taking a first stab at it, sort of easy, right? I mean, I know this was like drinking like from a fire hose, but like you could take the slides today, study them a couple times and be like, okay, I'm ready. And you're going to put together an action plan and you're going to start doing. And that's where, when the rubber sort of hits the road, that's where I've seen it's very important to have coaching, because teams, to Chris's point, you think you have a change, it's not really a change. And then all of a sudden you go through the cycle, you look at your outcome measure and you go, well, that didn't work. You need someone who's sort of riding alongside you to say, hey, don't worry about it. But actually, that wasn't a change. To Chris's point, oftentimes teams need to do, frankly, just some norming, especially when you have teams that are cross-disciplinary, right? Chris and his team from WKU brought Sky, that there was just some norming and brains, that sort of had to happen. But, to be told, to have someone to go to and say, like, I think I'm doing this right, but I'm not sure, and get coaching. So in the NASHNIC, basically what happens is teams put together their action plans, they all get submitted to me. I read 143 action plans and I notate on all of them, like, hey, think about this a little differently. Your measurement set does not match your change idea. So that way the teams are constantly sort of self-navigating this process. The other thing I would say is, I know I went over that really quick, like adapt, adopt, abandon. It's like so fast. You actually need to spend a lot of time and reflection on that, and having someone to think through that with you. Sometimes we will see teams say, okay, this worked really well. I just want to do more of it. And they're not thinking through, okay, what do the next 3 cycles look like? And for somebody, an experienced coach, to say, hey, let's take a step back. Maybe you learned something, but it's not the thing you thought you learned. And then I would say, lastly, when it comes, the transition from learning that something works in a test and then getting to implementation, scale, spread, and then something that we call hold the gains. All of that's sort of like more experienced teams. That's typically what teams run into in year 2. That needs special attention to make sure. Oftentimes what we see across all disciplines is we figure out what works and then we take it to scale, and then no one's paying attention to it. And what we see is regression to the mean, and all of the good improvement gets washed out. And there are ways to prevent that, but that also takes significant coaching. Did that answer your question?
Yeah, it did. Yeah. Thank you.
Lily, another thing that's really helpful, sorry to chime in again, is when we did the activity a little bit ago where we had the aim statement and we went through and looked at everything, lots of times we're so in the weeds and we know what we're doing. Having somebody else just look at it, they're able to quickly see the mistakes of what we're doing. And oftentimes the other one is you get tired doing it. You're like, I just want to be done. So having somebody else look at it and say, hey, have you thought about this or reflected here? I think even if you haven't done it, everybody was able to quickly pick out things that didn't look right in that example, just by looking at it. So I think that's a huge thing that's very helpful in this process.
Thank you, Chris. Okay, that was a lot. I'm going to go ahead and